across the world, those who are practitioners, those who are researchers, those who are scientists, those who are stakeholders, those are working in different domains of disaster management. So they will all come over. This is going to be one single platform where everybody will deliberate, where everyone will come together and put forward a comprehensive viewpoint with regard to disaster management, its resilience and action plan too. Do come over. Thank you so much. Namaskar. I am Durgesh Pant, Director General, Uttarakhand Science and Technology Council, UCOST, Dehradun. Today, the world needs disaster preparedness, disaster resilience, climate action, and science and technology-centric disaster management systems. In Uttarakhand Devbhoomi, we are organizing the 6th World Congress on Disaster Management from 28th of November to 1st of December. This 6th World Congress will have people from across the world, those who are practitioners, those who are researchers, those who are scientists, those who are stakeholders, those are working in different domains of disaster management. So they will all come over. This is going to be one single platform where everybody will deliberate, where everyone will come together and put forward a comprehensive viewpoint with regard to disaster management, its resilience and action plan too. Do come over. Thank you so much. Namaskar.
Disaster
विश्व को सही मार्ग दिखाती आ रही, कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग को खोजने के लिए उत्तराखंड सरकार 6th वर्ल्ड कांग्रेस ऑफ डिजास्टर मैनेजमेंट का आयोजन कर रही है। आखिर आपदा से जूझना और उससे जीतना हमसे बेहतर कौन जानता है। नमस्कार, धन्यवाद। आदिकाल से उत्तराखंड की धरती विश्व को सही मार्ग दिखाती आ रही। कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग को खोजने के लिए उत्तराखंड सरकार 6th वर्ल्ड कांग्रेस ऑफ डिजास्टर मैनेजमेंट का आयोजन कर रही है। आखिर आपदा से जूझना और उससे जीतना हमसे बेहतर कौन जानता है। नमस्कार, धन्यवाद। आदिकाल से उत्तराखंड की धरती विश्व को सही मार्ग दिखाती आ रही। कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग को खोजने के लिए उत्तराखंड सरकार 6th वर्ल्ड कांग्रेस ऑफ डिजास्टर मैनेजमेंट का आयोजन कर रही है। आखिर आपदा से जूझना और उससे जीतना हमसे बेहतर कौन जानता है। नमस्कार, धन्यवाद। आदिकाल से उत्तराखंड की धरती विश्व को सही मार्ग दिखाती आ रही। कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग को खोजने के लिए उत्तराखंड सरकार 6th वर्ल्ड कांग्रेस ऑफ डिजास्टर मैनेजमेंट का आयोजन कर रही है। आखिर आपदा से जूझना और उससे जीतना हमसे बेहतर कौन जानता है। नमस्कार, धन्यवाद।
I am Durgesh Pant, Director General, Uttarakhand Science and Technology Council, UCOST, Dehradun. Today, the world needs disaster preparedness, disaster resilience, climate action, and science and technology-centric disaster management systems. In Uttarakhand Devbhoomi, we are organizing the 6th World Congress on Disaster Management from 28th of November to 1st of December. This 6th World Congress will have people from across the world, those who are practitioners, those who are researchers, those who are scientists, those who are stakeholders, those who are working in different domains of disaster management. So they will all come over. This is going to be one single platform where everybody will deliberate, where everyone will come together and put forward a comprehensive viewpoint with regard to disaster management, its resilience and action plan too. Do come over. Thank you so much. Namaskar.
नमस्कार, मैं हूं पुष्कर सिंह धामी, मुख्य सेवक उत्तराखंड। आइए और 6th वर्ल्ड कांग्रेस ऑन डिजास्टर मैनेजमेंट में सम्मिलित हों और आपदा प्रबंधन में भागीदार बनें।
I am Durgeshpan, Director General, Uttarakhand Science and Technology Council, UCOST, Dehradun. Today, the world needs disaster preparedness, disaster resilience, climate action, and science and technology centric disaster management systems. In Uttarakhand Devbhoomi, we are organizing the 6th World Congress on Disaster Management from 28th of November to 1st of December. This 6th World Congress will have people from across the world, those who are practitioners, those who are researchers, those who are scientists, those who are stakeholders, those who are working in different domains of disaster management. So they will all come over. This is going to be one single platform where everybody will deliberate, where everyone will come together and put forward a comprehensive viewpoint with regard to disaster management, its resilience and action plan too. Do come over. Thank you so much. Namaskar. I am Durgeshpan, Director General, Uttarakhand Science and Technology Council, UCOST, Dehradun. Today, the world needs disaster preparedness, disaster resilience, climate action, and science and technology centric disaster management systems. In Uttarakhand Devbhoomi, we are organizing the 6th World Congress on Disaster Management from 28th of November to 1st of December. This 6th World Congress will have people from across the world, those who are practitioners, those who are researchers, those who are scientists, those who are stakeholders, those who are working in different domains of disaster management. So they will all come over. This is going to be one single platform where everybody will deliberate, where everyone will come together and put forward a comprehensive viewpoint with regard to disaster management, its resilience and action plan too. Do come over. Thank you so much. Namaskar. I am Durgeshpan, Director General, Uttarakhand Science and Technology Council, UCOST, Dehradun. Today, the world needs disaster preparedness, disaster resilience, climate action, and science and technology centric disaster management systems. In Uttarakhand Devbhoomi, we are organizing the 6th World Congress on Disaster Management from 28th of November to 1st of December. This 6th World Congress will have people from across the world, those who are practitioners, those who are researchers, those who are scientists, those who are stakeholders, those who are working in different domains of disaster management. So they will all come over. This is going to be one single platform where everybody will deliberate, where everyone will come together and put forward a comprehensive viewpoint with regard to disaster management, its resilience and action plan too. Do come over. Thank you so much. Namaskar.
आदिकाल से उत्तराखंड की धरती विश्व को सही मार्ग दिखाती आ रही। कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग को खोजने के लिए उत्तराखंड सरकार 6th वर्ल्ड कांग्रेस ऑफ डिजास्टर मैनेजमेंट का आयोजन कर रही है। आखिर आपदा से जूझना और उससे जीतना हमसे बेहतर कौन जानता है। नमस्कार, धन्यवाद। आदिकाल से उत्तराखंड की धरती विश्व को सही मार्ग दिखाती आ रही। कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग को खोजने के लिए उत्तराखंड सरकार 6th वर्ल्ड कांग्रेस ऑफ डिजास्टर मैनेजमेंट का आयोजन कर रही है। आखिर आपदा से जूझना और उससे जीतना हमसे बेहतर कौन जानता है। नमस्कार, धन्यवाद।
Disaster Director General, Uttarakhand Science and Technology Council, UCOST, Dehradun. Today, the world needs disaster preparedness, disaster resilience, climate action, and science and technology centric disaster management systems. In Uttarakhand Devbhoomi, we are organizing the 6th World Congress on Disaster Management from 28th of November to 1st of December. This 6th World Congress will have people from across the world, those who are practitioners, those who are researchers, those who are scientists, those who are stakeholders, those who are working in different domains of disaster management. So they will all come over. This is going to be one single platform where everybody will deliberate, where everyone will come together and put forward a comprehensive viewpoint with regard to disaster management, its resilience and action plan too. Do come over. Thank you so much. Namaskar. I am Durgesh Pant, Director General, Uttarakhand Science and Technology Council, UCOST, Dehradun. Today, the world needs disaster preparedness, disaster resilience, climate action, and science and technology centric disaster management systems. In Uttarakhand Devbhoomi, we are organizing the 6th World Congress on Disaster Management from 28th of November to 1st of December. This 6th World Congress will have people from across the world, those who are...
We will like to thank the organizers for giving us this opportunity.
I would like to welcome and introduce you to the chair of the session, Dr. Saroj Naithani ma'am, who has been the ex-Director General of Health Services, Uttarakhand, and ex-in-charge National Health Mission, who has led from the front in various aspects of education and training during disasters that have affected the state. She, however, had a commitment, so she had to go.
We have a team of eminent panelists here, comprising of senior clinicians, researchers, and public health specialists. I would like to introduce you Dr. Rohit Katre, working as public health specialist at AIIMS Rishikesh for last 3 years.
Dr. Nidhi Kaeley, who has been heading the Department of Emergency Medicine at AIIMS Rishikesh. She is a very active person, and she has numerous research papers in various national and international journals. And she's been a part of various national and international organizations and has organized many intramural and extramural projects. Dr. Madhur Uniyal, who is an active dynamic trauma surgeon who has been instrumental in developing trauma care in the state and is an integral part of the Level 1 Trauma Center at AIIMS Rishikesh. Now to introduce myself and my colleague, I am Dr. Takshak, emergency physician at All India Institute of Medical Sciences Rishikesh, and I have been working at AIIMS Rishikesh for the past 5 years.
And I am Dr. Archana, emergency medicine physician at All India Institute of Medical Sciences Rishikesh. I have been working at AIIMS Rishikesh for last 4 years. Today we will be taking about community health resilience and preparedness in the context of a disaster. Simply speaking, a disaster can be interpreted as an event that causes great destruction and damage and human sufferings. Community resilience is the ability to prepare for anticipated hazard, adapted to changing conditions, and withstand and recover rapidly from the disruptions. Disaster preparedness is a key step to resilience. There are various components that comprises disaster preparedness, including prevention, protection, mitigation, response, and recovery.
While all these steps might sound like the roles and responsibilities of the government, the outcome of a disaster is also determined by the preparedness of the community. As individuals, we need to prepare ourselves and our families for the worst, but we also need to think about our neighborhoods and their families and how we can help ensure their awareness and safety during emergencies. Community-based disaster preparedness is a process of bringing people together within the same community to enable them to collectively address a common disaster risk. Its role is to mobilize a group of people in a systematic way towards achieving a safe and resilient community or group. Its goal is a dynamic community that equalizes power relations, binds the group cohesively in the process of making decisions, deals with conflicts, resolves issues, and manages individual and collective tasks to successfully address the hazardous or disaster events.
An important characteristic of a disaster-resilient community is the healthcare capacity building. Once a disaster strikes, there can be various direct and indirect health-related impacts secondary to it. There can be death, injuries, communicable diseases, and mental health problems. While these are direct result of the disaster, indirect effects result from food, water, hygiene, sanitation, and environmental issues. Thus, healthcare professionals have a significant role to play in a disaster and post-disaster phase. To summarize, healthcare professionals play an irreplaceable role not only in the mitigation but also in the recovery phase from a disaster.
So while our distinguished colleagues and seniors here from other disciplines have talked about the various aspects of disaster, we would like to touch upon the healthcare aspect. So what is the meaning of disaster in the medical context? What is the role of medical personnel in the pre and post-disaster phase? Is there a role of a systematic and uniform approach to a disaster event? I would like to now invite Dr. Nidhi ma'am to shed some light on this.
So we all know why are we gathered here to discuss disaster, and I'll be discussing certain important topics and certain important definitions which we all need to know, along with our experience of COVID, dengue, and along with that, the most recent one, the tunnel evacuation. Of course, the pre-hospital setup, we have more senior specialists sitting with us, but what was our experience in the hospital setup, we are going to discuss about it. So we all know what is the definition of disaster. It is basically when the needs are more than the resources. So an event or its consequences that result in serious disruption of the functioning of a community and cause widespread human, material, economic, and environmental losses that exceed the capacity of the affected area to respond without an external assistance, to save lives, property, and maintain the stability, and integrity of the affected area is what is defined as disaster. So disaster management cycle has some of the important steps. The most important is preparation, response, recovery, and mitigation. We all know, I think, what is the pre-disaster paradigm. It is PRE. P stands for planning and practice, where we have to actually design, we have to we have to plan the implementation of the entire planning. We have to make it we have to make a formal planning, and we have to then further evaluate whatever our design is. Resilience is actually ability of individuals or community to rebound to a reasonable state of normalcy after an exposure to disaster or serious emergencies. So how the community or a population gets back to normalcy is what is resilience, and is the main topic what we are going to talk about, community resilience. Because we all talk about healthcare surge, we all talk about pre-hospital setup, we all talk about, but a lot of times we do not talk about resilience. It not only touches, as doctors we know, we are only bothered about the treatment aspect of it, but the psychosocial support, how the community gets back, because like in COVID, we saw a lot of communities, they lost their like in COVID, we saw, I'm sorry, I have the habit of walking and talking. So like in COVID, we saw a lot of people lost their jobs. So how they bounced back to normalcy. It also accounts for their education, their actually livelihood earning, so that, and their psychosocial support is what is important. Next important thing is education and training. So where we as doctors, we should be involved in capacity building. So I was actually listening to a lot of talks during last 2 days which were not delivered by doctors. So I am thrilled and I am excited to know that even the scientists and even the other professionals they have that sense that capacity building is important, is of paramount importance in disaster management. So it actually accounts for the medical management also, and as well as how a person who is trained in disaster responds in a disaster setting. So no, training is something else. Somebody told, a very senior person, today I was listening to a talk, that once you're training, okay, you've got a certificate of BDLS or ADLS, very good, awesome. But you're actually sitting in a flood area, and how the community people respond to that would actually the real experience, how they perform to it. So we have a lot of senior people, again, next talk will be on that. So education and training, we should go hands in hands with, that is the importance of both public and private sector. So we from public sector, from hospital setup, we should be involved, we should go, the training aspect should be the collaborative effort of both the hospitals as well as the industrial institutions, the national disaster forces, etc. So disaster paradigm is again a revision of what we already know. D stands for detection, where the problem is actually, where the problem area, affected area. Detection is very important. Then incident, I stands for incident management, S is the safety and security of the healthcare provider. So we are not going to send a person who is actually likely to get injured himself, so, and create another disaster for the community. So safety and security of the healthcare provider is to be kept in mind. Then A is to assess the hazards. There can be both types of hazards. It can be primary or secondary. Something we all know, suppose a building has fallen, it will lead to trauma, head injury, and all kinds of fractures. But if a gas pipeline, for example, has ruptured, there can be associated release of the toxic gases. For example, the tunnel evacuation. So we were looking at, okay, these individuals would get injured because of the direct trauma. But actually, there could be they could have been lack of oxygen, hypoxia. So these were all the secondary disasters could have happened. So that is why the oxygen was pumped in through the tunnel and everything happened. So we should have an idea what are the primary and secondary hazards which we are looking at and manage the patients accordingly. Support is important. Again, the collaborative effort of public and private organizations. So a lot of organizations came into picture during COVID, during dengue, and this tunnel evacuation. Triaging is important because we don't want to miss a treatable patient. We don't want to leave a treatable patient, somebody whose life requires immediate intervention. And we also have to decide legally and ethically whether intervention we will be able to do also. So there are actually multiple triaging. One of my faculty members would be discussing about triaging also. Now there are set principles of triaging, but my triaging way can be different from your triaging way. And again, it will actually depend on the area you are involved. Suppose your expertise is not there in a particular, a medical intervention. And so you will not pick up that person first, but you will pick up the other person who you can actually intervene first. And then again, you have to look at the life-saving principles of triaging. So triaging and treatment, and E stands for evacuation and R is the recovery, both health recovery, psychosocial aspects. So detection is the do current needs exceed available capabilities and resources. Is there a suspected threat or hazardous material present? Again, to detect the primary and secondary hazard assessment is of paramount importance. Incident management, three C's are there. So communication, command, and coordination. Communication is, there are multiple ways of communicating. You can actually use your radios, your TV. You're communicating about a risk. You're communicating about a disaster. But you do not want to create a panic amongst the general public. So one of the actually speakers was saying a very effective way that, you know, in Italy, it is actually a seismic prone area. So they don't want to tell you, okay, look, you have to be careful while entering this building because this building will have an earthquake in another second. So what they do is they're actually putting cartoons on the buildings, and they're saying they're actually communicating in a very subtle manner, but they're communicating to the general public that this is a seismic prone zone. So communication is a key, but keeping in mind the various aspects that you do not want to create panic, but you have to alert the public. That is very important. So command, one has to take the command. Coordination, again the coordination among different public-private organization is important. Safety and security, as we said, the immediate scene may be too dangerous to allow any responders. The responder safety remains paramount. Triage, treatment, evacuation of casualties become secondary consideration. So you have to, the scene should be safe enough for the healthcare provider. You do not want to create any further disaster by injuring. If there is a risk of injury to your healthcare provider, you will actually be very cautious regarding the scene safety. And again, in that, the secondary aspects, the secondary hazards are important. So assess the hazards. As I've already spoken, the emergency responders must remain vigilant to these hazards and take appropriate precautions to protect themselves and others. Support means getting what is needed to get the job done. So like in this context, the tunnel evacuation, we had support of lot of organizations. So we got the building, we got big machines, and ultimately the rat miners came into picture. So we had the support of Indian Air Force, we had the support of NDRF, we had the support of Indian Army. So everyone, so both private and public organizations have to chip in for effective disaster management. Triaging, greatest good for the greatest number of possible survivors is the key to effective triaging. Now this we've already spoken. Health-related considerations in disaster planning is effectiveness of preparedness, is the knowledge of potential of hazards and appropriate countermeasures. So you should basically have D is detection, I is incident management, and second is A is assessment of hazards. So you should be able to assess the hazards, both the primary and secondary hazards, and what are the countermeasures, what measures you can take to counter those secondary and primary hazards. So effective planning requires integrated collaboration of the entire disaster response system. Community members should be encouraged to participate in a disaster. Like I said, you can train an n number of people with basic disaster management, with advanced disaster management, but if you do not involve the community members, how will your personnel who is actually experienced, who is actually trained in basic disaster management, will reach to the affected area? The actual response would start from the community itself, right? The person who is present there should be trained. That is what the community response is all about. The community members should be trained, should be encouraged to participate in disaster for effective management of disaster. Planning so that they're informed about the local response procedures. Plans should also address the long-term, short-term objectives of preparedness, response, and recovery activities. Plans need to be physical. It should consider physical, behavioral, and emotional factors. There are certain important things. Risk perception is how people perceive and measure the risk. Hazard analysis is assessment of the magnitude of the impact. It should include both the primary and secondary hazard analysis. Vulnerability assessment is important, while triaging also, who is actually the vulnerable population, the geriatric population, the pregnant females, infants, children are vulnerable population. This is as per your age and sex. It can be as per your socio-economic background also. Capacity assessment is, suppose in hospital, as a medical superintendent, I should do the capacity assessment. What I have, what I need more. Where do I need to expand? We got the first COVID patients. So then the assessment started. Okay, PPs we don't have, masks we don't have, ventilators we don't have, concentrators we don't have, oxygen supply not adequate. So by the end, those were actually my next question is the lessons learned from COVID. So let me actually elaborate on that. So after the end of the first wave, we realized all that. So that is the importance of your disaster management, which from hospital point of view, that a lot of times, and resilience, vaccines, we got it at the end of the first wave. So ICMR, effective triaging, yes, ICMR was alert enough. The ICMR gave us that effective one of the ways of effective triaging was saturation less than 94 or more than 94%, where we could actually send the patients back home. If your saturation is fine, beta ghar chale jao, koi baat nahi. And then the effectiveness of telemedicine and tele-education. Training and education. We were training these people through tele-education means. We were actually connected, we connected AIMS to the doctor sitting in periphery who knew how to measure the oxygen saturation and who knew only how to measure the vitals. So we connected we connected ourselves with the help of tele-education, and we taught that doctor in the periphery how to use a ventilator. That helped. At least he could save few lives, although it had a catastrophic effect. Another concept during COVID which we learned was the psychosocial aspect. So like in the end, in the previous slide, the plan needs to consider physical, behavioral and emotional factors. Before the COVID-19, nobody talked about the psychosocial aspect of planning, the effect of burnt out on the healthcare provider. But during the COVID-19, it had such a catastrophic effect on the behavioral aspect, on the psychosocial aspect of the doctor, and even the community, even the local person, that we started talking about depression more, we started talking about the burnt out effects, we started talking about, more emphasis was laid on the working hours and psychological stress on the people. So was also one of the lessons learned during COVID-19. So how you're managing your hospital inventory, that was a lesson learned by the end of the first wave. By the end of the first wave, entire India had more number of oxygen plants. We had in Uttarakhand DRDO hospital set up thanks to the army personnel, and which was actually managing a lot number of patients. Role of telemedicine, actually it was decided, ISRO found telemedicine, tele-education in 2011. But we started using it, emphasizing on it, telemedicine, tele-education, after COVID-19. We started talking more about it because that was a need of the hour. Because we triaged those patients through telemedicine, we tele-educated, we were involved in training, healthcare through telemedicine and telehealth, we were actually giving medications also through telemedicine. Yes, so this was actually the main thing, and one of the important aspects from hospital healthcare point of view is the role of mock drill exercises and drills is important from hospital set of view. We should create such scenarios, tabletop scenarios, real scenarios, and do frequent exercises to be more prepared for any kind of disaster. Yes, thank you so much. So,
like my friend, he's a trauma specialist. His concern is number of people we are losing more than 5 lakh people due to road traffic accidents. And police says 1,60,000 people die on spot. There are other people who die who could be saved even if some primary prevention or first aid could have been provided to them before hospital, but they die. So his concern is how to reduce the mortality, how to make community
Sir, yes, so that is why I was emphasizing a lot on the telehealth and teleeducation, because the communication is a key. First you have to communicate. That is why I quoted the example of, not actually communicating in a subtle manner, but actual communication. If you were going to tell ki dekho kal flood aa jayega community, so the general layman would actually lot of panic. Communication, and of course the role of community leaders, community actually active participation, rather than doctor going there and acting. You have to, the role of implementation projects, like in the sense what I can do as a doctor is I can take up implementation projects. I can take small PHCs, I can take a gaon for example along with my community health person, and I can see what are the lacking issues in that gaon, and do the training so that they can act accordingly. BLL. So capacity building, training, education is what is required. Right, sir. Right, sir. Right. Yes, absolutely.
How we can help community by reducing the mortality if we train them.
Yes.
Use their capacity, colleges, universities, you should take as a challenge and do it in practice.
Yes. So communication and capacity building is, I think, the key. Thank you so much, sir, for your inputs. Right.
Thank you, ma'am, for your succinct message. So, a systemic approach to a disaster event can bring about uniformity amongst the various agencies who are dealing with the disaster. It gives them a common language and simplifies matter. Do disaster have a public health impact? What should be the public health response to disaster? I would like now to invite Dr. Rohit Katre, who is a pioneer in the public health, to shed some lights on this matter.
Thank you for the introduction. Myself, Dr. Rohit Katre, working as junior faculty at AIIMS Rishikesh in Department of Community and Family Medicine. So I will be giving talk on public health response to disaster. So coming to overview of global disaster and public health, millions are affected yearly by natural and man-made disaster worldwide. The year 1999 showcased the devastating impact of natural hazard, and many natural hazards such as tornadoes, hurricanes, heavy rains and earthquakes impacted us, and the disaster leaves thousands of people dead as well as millions are affected, which leads to homelessness, economic losses and injuries. There has been limited application of public health principles to disaster management despite the human toll. Coming to disaster trends in 2022 and the COVID-19 impact, Emergency Event Database, which is our database, recorded 388 natural hazards and disasters worldwide in 2022. There were loss of 30,704 lives were lost, and it affected 185 million individuals. It also resulted in loss of economic loss in tune of 48 million US dollars, as well as there is increase in climate related disaster globally in 2022. Asia alone witnessed 98 climate related events, mainly floods. So coming to the disaster, what exactly is disaster? Disaster is basically made up of two things. We can consider it can be made up of two things: hazard plus vulnerability. Hazard is any event, natural or whether man-made, which adversely affect human life, property or activity. And vulnerability is predisposition to suffer damage due to external factors such as rapid population growth in the area, which both of the activity can lead to a significant disruption to the normal functioning conditions of hazardous event, interacting, exposure, vulnerability and capacity. So Sendai framework is the framework given by United Nations Disaster Risk Reduction, which classify disaster into different subtypes. They can be classified into small scale disaster such as localized impact, which require assistance beyond the affected community. large-scale disaster which affects society, necessitating national or international assistance, such as earthquakes. Frequent and infrequent disaster, it's based on, they are classified based on the probability and return period of hazards. Slow onset disasters, which gradually emerge over time, and sudden onset disaster, which are triggered by rapid or unexpected hazardous event. So coming to public health emergency and disaster preparedness, it involves a comprehensive approach that encompasses prevention, mitigation, preparedness, early response and rehabilitation within the health sector. So in the emergency and disaster reduction in health includes prevention, mitigation, preparedness, early response and rehabilitation, along with planning for prevention and preparedness, management of mitigation, early response and rehabilitation in event of public health emergencies and disasters that impact public health, and implementation of international health regulation. It also includes involvement of entire health system and broadest possible intersectoral and inter-institutional collaboration by developing policies and plans and executing activities that reduce the public health impact of emergencies and disasters. So this slide shows the disaster management cycle. As soon as disaster strike, there has to be immediate response which can be generated from the local community, followed by immediate relief and assessment of the disaster to follow up with the reconstruction phase. Once the disaster recovery phase is over, we can proceed ahead with long-term planning for the prevention of disaster to occur, mitigation, how we can mitigate disaster, and preparedness for the disaster if it ever occurs. So for that we require capacity building. So coming to function of preparedness, there are core functions. Planning function, planning function, periodic, which involve periodic risk and vulnerability assessment, and emergency planning and risk categories. So this slide shows the component of planning for prevention and preparedness, which involve periodic risk and vulnerability assessment, emergency planning and coordination structure. The periodic risk and vulnerability assessment is involved in engaging in activities that span prevention, mitigation, prevention and early response and rehabilitation. Emergency planning is basically intersectoral coordination among all different sectors for potential emergency situation, as well as pre-crisis mapping of who does what, where and when, that is 4W matrix, and there should be sector specific protocols in the event of an emergency. And third is coordination structure, means there should be alert system for specific disease outbreaks and emergencies. So coming to impact of natural disaster on public health, there can be direct impact and indirect impact on population health as well as healthcare system. So coming to direct impact on population health, it can lead to physical trauma such as injuries, death, acute infectious or communicable diseases, as well as psychological or emotional trauma. Coming to direct impact on healthcare system, it can lead to damage to infrastructure, as well as there is crisis due to increased demand for healthcare services. Indirect impact on population health can be due to loss of primary healthcare, loss of normal living condition, as well as there can be population displacement. And indirect impact on healthcare system can be considered from the point of view there is a loss of communication, water supply or electricity. So once the disaster strikes, there should be a post-disaster management which involves search, rescue and first aid, triage and tagging, followed by transport of victims to the hospital, and there should be early communication to the hospital for providing treatment, as well as followed by epidemiological surveillance, and if there is any epidemic it should be controlled, and if it requires vaccine or vaccination, that should be conducted post disaster. So triage, the patient can be classified into different categories, red, yellow, green and black, depending upon the means treatment they require. Then international health regulations. They are for the fostering global partnership, that is collaborating with international entities to enhance response capabilities, building public health capacities, that is strengthening surveillance and response capabilities globally, ensuring public health security, managing specific risks, sustaining rights, procedure and obligation, and the performance of studies, that is conducting assessment to measure progress and identify areas for improvement. So coming to recent disaster, one of the recent disaster was COVID-19 pandemic, which WHO declared it as an public health emergency of international concern on 30th January. Index case was from Wuhan. Till 20th November, 772 million cases have been reported. So coming to public health response to COVID-19 pandemic, it has been means multiple agencies work together, such as World Bank, WHO, union and federal government, state government, together to provide implement range of measures such as lockdowns, testing and contact tracing, vaccination campaigns and public awareness campaigns. And one of the recent disasters is Mamtok, Uttarakhand tunnel collapse, Silkyara Barkot tunnel collapse with worker trapped inside in. And on 12th November, a part of under construction Silkyara Barkot tunnel caved in Uttarkashi district of Uttarakhand. Aid was supplied in the form of food, water, oxygen supply. On 28th November, in the evening, they all 41 workers who were trapped, they were successfully rescued. This event was an eye-opener that in case of even man-made disaster, we need to be fully prepared for any mishappening. Nodal agencies which were involved was NDRF, State Disaster Response Force, Uttarakhand Police, engineers from Indian Army Corps of Engineers and Project Shivalik of Border Road Organization. Thank you.
Thank you, sir. That was indeed very enlightening.
Uttarakhand is also known as the land of gods or Devbhumi. It is a mystical land of mountains and associated mythologies, exhilarating adventures, and yoga. These adventures and pilgrimages bring with them their own share of mishaps, leading to injuries, deaths, and disabilities. So, can road traffic accidents and injuries can take the form of a disaster? I would like to now invite Dr. Madhur sir, a dynamic trauma surgeon, to shed some light on this.
Thank you very much, Takshak. And a very relevant question. Road traffic injuries, can it be a disaster, right? So when we talk about road traffic injuries, let us define disaster in a way that we can address this problem properly. Three definitions are relevant. First is multiple casualty. Second is mass casualty. And when mass casualty turns into a disaster. So multiple casualties when the resources are strained but not overwhelmed. Mass casualties when the resources are overwhelmed. And disaster is when you have to take the help of another geographical area. That geographical area cannot cope up with that thing. So that is essentially the difference between multiple mass and disasters. Can road traffic injury be disasters? Okay, fine. I was just reminded by the chair that the theme of the discussion is resilience of public. So I'll try to include that thing along with my discussions. So first thing is, we talked about COVID a lot, right? We talked about other diseases a lot. I just want to give a perspective here, right? When we talk about road traffic injuries, we think it's an act of God, right? It is an accident, something happened. We don't see it as a health problem. We don't realize the enormity of it. I also want everybody of us to please close their eyes or just think what I'm going to say. When we're talking about COVID, so we are saying it's a disease of the century. We are those generation during in their lifetime when COVID happened. I've seen people, doing with COVID. Considering COVID in Indian perspective, all right, 5.5 lakh deaths. Yesterday I was seeing that it is 5.37, but for comparison's sake, let's make it. So 5.5 lakh people died because of COVID in India, and COVID is almost gone now. Mortality is, it's not happening except. If you consider the death due to road traffic injuries in the same period when there were lockdowns, in the same period where traffic was almost null, where the rivers were rejuvenated, where the pollution AQI improved even of Delhi, in that period it was 4.5 lakhs. And COVID has come down today. What about road traffic injuries? They have increased. And 5.5 lakh is an average death due to road traffic injuries 1 year in our country. So we need to think about our priorities when we think about, and this is not it. I mean, to see it in the public health perspective, if to see it as a loss to a society, when we consider dailies, that is disability adjusted life years, which comes down to years of life lost due to disease or death. That is much higher in road traffic accidents. Majority of population who died in COVID were comorbid, were old, were frail, transplant, elderly, more than 65. Road traffic injuries kill the young people. People who are out of their houses for studying, people who are there to earn the livelihood of their family. It kills those people. And the years of life lost to a society are huge. So now I think I've made a justification of the problem statement. So, and let's see how we see it in terms of disaster. So what is a disaster? We just discussed. When that geographical area is not able to cope up with it. So for example, I would like my fellow people here in the audience to think whether the Silkyara accident which happened was a mass casualty, multiple casualty, or a disaster. It was a disaster because help was to be poured from other parts of the country as well. Prime Minister's office took over. Help was sought from other specialities, from other countries, Australia and all those, we sought their technical advice. So it was a disaster. So to convert an incident into a disaster, it just takes the incapability of that geographical area, right? So yes, it can be a disaster. So now to see how can we look at it? How can we look at the problem? We can look at it in three ways. We can look at it with a glass of considering India as a collegium of states, right? So when we consider India as a collegium of states, the fabric of the care is heterogeneous patchwork. Some places it is very good. Gujarat has a centralized command system for years. Not many people know about it. Kerala has a wonderful ambulance facility. Odisha, 48 hours cashless for anybody. Tamil Nadu, deaths are high, but they're gearing up very quickly. And now Uttarakhand, which is also coming up in 48 hours cashless and moving in that direction, learning from all these people. But rest of the country, where are we today? There are no central guidelines. There are no central audit mechanism. There are no recommendations. So the fabric, good practices, bad practices, no practices. It's a homogeneous. Another way of seeing at road traffic injuries as a disaster is when you consider it in terms of habitation. For example, road traffic injuries in villages, road traffic injuries in townships, and then road traffic injuries in metros, right? So let me discuss the solutions together when we're talking about road traffic injuries in various areas, right? For example, if you consider road traffic injuries in villages, and let's further subdivide them to a care to a trauma victim because of road traffic injury, since that is my topic, can be divided into three phases. Pre-hospital phase, when the patient is injured and he has to reach the hospital. In hospital phase, where he is in the hospital, and then rehabilitation, when we have to return him to the society as a useful person, as a productive person, not a burden on the family, right? So when we consider villages, the pre-hospital is somehow doing good now. 108, initially it was non-existent, but now 108 ambulances come. They can call somebody and somebody can pick them up. In matter of in-hospital care, it is still a lot has to be done in the villages. There is, I don't know there are good hospitals enough that can take care of people, that can do blood transfusions, that can do, orthopedic procedures or trauma procedures. So that is where the country has to work upon. And then the rehabilitation part, non-existent, right? Then we come to townships. So townships have a fair amount of pre-hospital care. Now, many private hospitals have their ambulances, though there are not ambulances, but there are vehicles which can transport patients. Some of it is there. In hospital care, probably there's one good hospital which might provide some quality care, all right? Or there might be CHCs which are doing very good at some places. But rehabilitation, okay, fine. Jaipur foot is still the commonest foot in India, so we can know what rehabilitation we are offering today. Then we come to the townships, cities. A wonderful thing is happening in metros. Amazing hospitals, amazing medical colleges, providing very good in-hospital care. Pre-hospital care is available, whether you can pay for it. You call up any corporate hospital, it'll send you an ambulance within minutes, and you can reach there. There are some facilities laid by the government. There are 108 CATs in Delhi. You can call them up. In-hospital facility is amazing. Rehabilitation is independent. You have to take care of your own rehab, right? So that is where, as a system, we have to work upon. So, but one thing is missing from all these places, that is processes and protocols. There are no uniform processes and protocols either in villages or in cities or in townships. Now, what do we do about it? Since the topic is about resilience in community, and I'm telling you AIIMS Rishikesh example as well. When we started this trauma center 5 years ago, we were very gung-ho, we were very young group of doctors, not very senior people, and there was actually no senior people with us. And we had a feeling that, we're going to change the face of trauma in Uttarakhand. So 6 months happened, and as colleagues we were talking, what has happened differently? So when I was there in my alma mater, AIIMS Delhi, we used to get non-responders on a very frequent basis. Non-responders are people who don't respond to initial treatment, or people who might die in seconds, right? There's a pulseless electrical activity, and people can die in seconds. Why are not non-responders coming to us? Okay, fine, let's see our data and analyze. We examined the patients, the mass casualties happened in last 6 months. There was a school bus accident in Tehri Garhwal. 40 children died on the spot, 4 reached AIIMS Rishikesh. There was a bus fell into a gorge in Uttarkashi. 34 people died on the spot. Rest reached AIIMS Rishikesh. Bus accident in Chinyali Sod. Bus accident in Neelkant Road. So around 6 or 7 multiple casualties were there during that duration. None of them was non-responder. We calculated their injury severity score, and we found them of moderate injuries. So then this thought came, what is the use of a level 1 trauma center if you're not catering to the population which actually needs you? And how can you help when people are not reaching you alive? For you being a level 1 trauma center to help those people, they should come to you alive. So the problem was in the pre-hospital setting. Problem where road traffic injuries turn into a disaster in the pre-hospital setting. So what could we do about it, and what should be done? AIIMS mandate is in hospital care, but somehow we were allowed by the administration to progress it to the pre-hospital care as well. And what is the way forward, solution? We started training SDRF because it was the most used agency in Uttarakhand. After 2013 it was formulated. SDRF till date does not have a definition of disaster, that when they should be activated, it is activated randomly or maybe whenever it is decided. No protocols till date. We reached out to the police, which is the first responder in many cases. We started our training programs. We started police training, and which was obviously, then COVID came and it was shifted into a COVID care program. And then we started reaching the school children. So the resilience of the community, we believed, was amazing in school children. I want to share an anecdote which is very relevant here. In 2016, I was in Japan on a short fellowship working in Osaka City University Hospital. And on the morning rounds, and their emergency and trauma are combined. So in the morning rounds, VC patient, and the resident was giving overs to the seniors. Or this patient found on roadsides, brought by bystanders. This patient researched by bystanders. This patient researched by bystanders. I said, I mean, amazing bystanders you have here. You know, in India, nobody can save a life, be it a doctor working in some other branch. You guys are doing amazing work. They said, no, no, no. Our bystanders are trained to put AEDs. So they know where to put artificial electronic defibrillator, right? So they just know, and the machine decides. I said, amazing. I was coming back, landed up in Delhi, wanted to get some toys for my children. I went to a shopping mall, huge shopping mall in South Delhi, and I see an AED device. I had a lot of time to kill to reach the airport, so I asked the floor manager, what is this device? I said, Pata nahi, what is that? We don't know about it. I had time to kill, I had no better place to go. I thought, let's escalate. He called his supervisor. So what is this device? So this is an electronic device to help in the case of heart attack. I said, wonderful. What do you do if somebody has? We don't know. Escalated it. The mall in charge knew nothing about AEDs. So one thing I realized, the provisions are there. If it is there, it would have been mandated by law, right? But the capacity to do that is not there. So I'm telling you about the Japan incidents because one fine day, a colleague, a surgeon of mine was there and he said, do you want to come to a festival? I said, what is this? A school children festival. I said, why not? Because I wanted to see everything. So there's a prefecture in Japan called Kobe. Like we have state, they have prefecture. So I went to Kobe. So every year they have a Kobe Kairu caravan. So there's a festival where children are taught methods to deal with disaster since earthquake-prone areas. So they don't know what they're doing, but they know how to carry a fellow child, how to douse fire, where to gather at a muster point. So all these things was there. And these things are repeated when they give their exam of their 10th, when they do their graduation, when they get a big degree, they have to clear it at multiple times. And it is ingrained in their thing. So the realization that we have to catch them young. We started a school training program in the Uttarakhand. And this year, we trained more than 6,000 children. AIIMS Rishikesh trained more than 6,000 children for pre-hospital trauma care. That is the way the community can move forwards, bridge those gaps. Then again, the role of community comes at the time of biggest gatherings of earth, happens in Uttarakhand. That is Kumbh Mela. Population, about the whole population of United States, just short of that, that population takes bath on the bank of Ganges over the period of 4 days. So this is the amount of gathering which we have. Then there are Char Dham Yatras. And the interesting point is that these gatherings have been happening for hundreds and thousands of years. And we know that after 5,000 years, which city this is going to take place. Who are the people who can be impactful from the society in these things? Of course, whenever you want to go to Uttarakhand, you hire a Pahadi driver, right? Somebody who can travel on the terrain. So our target was now, we have to train the drivers. So with the help of RTOs, now we're building a force of first responders in all the 13 districts. We have to train 50 each from each district. So in 13, and out of them, we will hopefully try to get some people who can train others and spread this motion in the society. So the brief answer of your question is, yes, road traffic injury can turn into a disaster. But with proper society resilience, even in the most populous places, we can curtail it to a multiple casualty or a mass casualty event. Thank you.
Thank you, sir, for your insights. We operate a level 1 trauma center at AIIMS Rishikesh, which is manned by highly trained people from both the medical as well as surgical specialities. In the context of a disaster, is it necessary that all injured patients be transported to a level 1 trauma center like we have at AIIMS Rishikesh?
Fortunately, the answer is no. And that is the way it should be. Giving the example of my state, we realized that if something has to be done, we have to analyze the health problems in the state. Whenever we talk of healthcare and trauma, it is very simple. Airway, breathing, circulation, disability. Clean the patient's airway, stabilize his cervical spine. If he's not breathing properly, assess why he's not breathing properly. 2 or 3 procedures to do that if the circulation is falling, there might be a blood, either it's bleeding outside or bleeding inside. 2 or 3 procedures which can be taught to a layman. Disability, if there is a head injury, what to do, right? So these things are very, so once I was calculating from a normal shop in Uttarakhand, so it takes around 1800 rupees to save a life of one patient, and that is the upper limit. If you use more saline bottles, if you use, so just 1800 rupees is sufficient to save somebody's life, and 90% of lives can be saved by these. So 90 patients are not, there are scientific jargon, I don't want to go red, yellow, green criteria, but only 10% of the patients who meet with these injuries are in the red area, which require a level tertiary care hospital. So of course, they don't require, answer is very simple. Answer is not resources. For example, I was national assessor on the basis of Niti Aayog also, so I assessed a few of the hospitals about their emergency and care. What I realized was resources, we keep about cribbing about resources, कि इंडिया में हमारे पास resources नहीं है, we are resource poor state, भाई गांव में क्या होगा? You don't need resources. The same resources, the same IV stand, the same drip, the same injection, the same bandage can save lives. What we are not having is capacity building. What we are not having is people who know how to use them judiciously. So yes, they don't require trauma center. Trauma center should be, a level 1 trauma center should be for a very small population. It is in black and white, fortunately. But everybody does not need to be rushed, especially in times of disaster. Since it's a disaster conference, there will be surge at the trauma center, which should not be done. So it should be, that's why we need a centralized command system for trauma. You know, somebody who can view from the bird's eye, send only select patients to a level 1 trauma center. Rest can be distributed. Upar tragedy, I want to just mention, Upar tragedy, there's a movie also on Upar tragedy. There was a fire in Upar. And people said, fire? Everybody should rush to the burns unit, the biggest burns unit in this, which is the biggest burns unit of Asia. Very well, fortunately in Delhi, Safdarjung Hospital. All the patients were rushed to Safdarjung Hospital, right? They all required was simple oxygen. But their Safdarjung Hospital got overwhelmed and a lot of people died because they could not get just one oxygen mask. So it should be very judicious, it should be centralized. Had these people been distributed in areas and only sick patients would have reached Safdarjung, I think casualty would have been much less. Thank you. Any other question? Okay.
Thank you, sir. That's very well put. In a disaster setting, thus we know that injured patients would need to be transported to different healthcare settings. So, sir, since we know that they need to be transported, are there some protocols in place that need to be followed for transportation of injured patients?
Fortunately, yes. And the answer is as simple as A, B, C, D, E. Airway, breathing, circulation, disability, and exposure. You know, if there's anything in the mouth, take it out. If the airway is not patent, put a tube or a mouth gag in it, stabilize the cervical spine. Check the breathing of the patient. Is wearing any tight clothes, remove it. If there is any injuries, address it. Control the bleeding. You know, stabilize patient on a spine board and move. So the answer is A, B, C, D, E.
Thank you, sir, for your detailed insights. I'm sure that we all know now that injuries can
Thank
be
you.
disaster proportions. People with suspected or confirmed injuries should be handled with Hello.
Hello. Check.
Dr. Madhur, sir. I now invite Dr. Ashutosh, sir, to kindly felicitate Dr. Archana. So this is.
Now I invite Ashutosh sir to facilitate Dr. Takshak.
I now invite Dr. Ashutosh, sir, to kindly felicitate Dr. Rohit Katre. I now invite Dr. Ashutosh, sir, to kindly felicitate Dr. Bhargav.
Hello. Check.
Thank you, sir. Thank you so much. Thank you to all the audience for their patient listening. Thank you, everyone.
Good afternoon, everyone. I am Dr. D.P. Uniyal, Joint Director for Science and Technology Department, UCOST. And now we'll be having a very interesting session on role of Indian Armed Forces in humanitarian assistance and disaster relief. So, morning time, we have seen the presentation of Brigadier Singh. It's very interesting, although time was short. So I hope we will be able to see the full-length presentation of yours here. And now I request Colonel Bhatt for further proceeding.
Thank you. I'm Colonel Madhukar Bhatt, CO 4 Marathalai, one of the battalions which is here in Birpur. As part of the panelists here, along with me, I have my commander, Brigadier UP Singh, then Air Commodore KS Lamba, as also Colonel Hemant Devlal, who would be undertaking the brief on the role of armed forces as far as HADR operations are concerned. Initially, we'll be having Air Commodore K.S. Lamba give a brief insight into what are these roles. Further, then self and Colonel Hemant would be taking on the proceedings thereafter. May I invite Air Commodore K.S. Lamba, please.
Okay, good afternoon, everyone. I don't think I'm at the best time in the day to cover a presentation because it's a little late in the afternoon. I'm sure everybody's had a good lunch, and we've had some very serious people telling us about medical and all relevant things, but definitely a lot of serious stuff going on. So I thought I'll have something which will make it a little light but relevant. I'd initially had this presentation for a duration of about 35 odd minutes, but I'm given to understand that time is at premium. So I'll try and make it short and try and make it a little interesting. Just to give a quick introduction, I'm Air Commodore Lamba. I'm the base commander at Air Force Station Chandigarh. I'm a pilot by profession. I fly the IL-76 and I've flown about 6 different types of aircraft. I'm an instructor on all these aircrafts, and I've had first-hand experience on almost all the HADR missions that the Air Force has participated in from the mid-90s. And I can start with, say, the super cyclone in Orissa, going on to the Bhuj earthquake, the tsunami, the floods in Srinagar, Nepal earthquake, and I hope I'm not missing out anything, so on and so forth. So, a lot of things we've learned along the way, and I'll share a few things from the Air Force perspective. And the topic would primarily be the role of the Air Force in disaster management. The Indian Air Force is one of the core national response capacity responders and tends to be amongst the first responders in the wake of any natural calamity or man-made disaster. The IF plays a crucial role in disaster relief by providing swift aerial assistance to affected areas. The traditional tenets of air power are employed to support disaster operations, which include centralized coordination for decentralized execution, prioritization, and concentration of missions based on urgency and impact. This is done to deliver aid to the remotest areas while maintaining flexibility in response during changing disaster dynamics. Considering the intensity of disaster where time is of utmost criticality, aerial assets are the natural choice for delivering the requisite assistance in the shortest possible time. The IF's commitment to HADR reflects its cognition of the crucial role it plays in alleviating human suffering during any crisis. Through a combination of domestic and international efforts, specialized units, and a collaborative approach, the IF strives to contribute significantly to relief operations and community resilience in the face of disasters. This remarkable contribution of the Air Force to the nation embellishes our credo, mission, integrity, excellence. No statement exemplifies the essence of undertaking an HADR mission better than the remark by the former Chief of our Air Staff, Air Chief Marshal N.A.K. Brown. He stated, and I quote, "Our rotors will not stop churning till each and every stranded person has been brought to safety."
Mother Nature, when brings its wrath and creates havoc, there are some you can rely on. The primary role of the Indian Defence Forces is to safeguard the nation's sovereignty from external threats. But when called upon, they are equally proficient in performing HADR operations. The Indian Air Force, in particular, has a distinct edge due to its characteristics of long-range, swift mobility, and super heavy lift capability. Other than countless rescue missions within the country, many nations have benefited from the humanitarian assistance and disaster relief and non-combatant evacuation mission capabilities of the IAF. During the devastating tsunami of 2004, India launched Operation Sea Wave for relief, rescue and evacuation. Apart from relief missions for own people, the IAF also provided assistance to Sri Lanka, Maldives and Indonesia. The 2013 cloudburst and subsequent flood in Uttarakhand exemplify the coordination between Indian Air Force and Indian Army, which were the key players in all rescue missions. The fact that Indian Air Force evacuated 23,892 people, delivered 798 tons of relief material, and flew 3,536 missions in 65 days demonstrates the successful capabilities of HADR, developed and employed by the country over the past 2 decades. In May 2017, India swiftly responded in providing relief supplies and medical assistance to flood-ravaged Sri Lanka, and at the same time rescued many Bangladeshis from Cyclone Mora in the Bay of Bengal. After the devastating floods in Kerala in August 2018, IAF launched massive rescue and relief operations. 47 aircraft, including 5 C-17, 3 IL-76, 5 C-130J, 10 AN-32 and 24 helicopters, took part in the rescue and relief operations, flying 1,121 sorties and airlifted 4,209 passengers and 1,554 tons of load. In April 2021, a Mi-17 helicopter of the Indian Air Force was employed in the Garhwal region of Uttarakhand to douse the forest fire. The aircraft used a 5,000-litre capacity Bambi bucket to collect water from the nearby lake. In the last 3 years, the IAF has been instrumental in providing extensive support to sustain COVID relief operations. The much-sought oxygen concentrators were bought from various countries and were provided to all the required users. The medical supplies and vaccinations were flown to the remotest places in a short span of time. In April 2022, Indian Air Force, in close coordination with Indian Army, NDRF, and local administration, rescued 35 stranded persons from the Trikut Hills ropeway service in the Devgar district of Jharkhand. IAF utilized 2 Mi-17 V5, 1 Mi-17, 1 advanced light helicopter, and 1 cheetah to fly more than 26 hours towards this effort.
वायुसेना के हमारे हेलीकॉप्टर लेके संभालने वाले लोग हो या तो आप गरुड़ वाले लोग हो, आप सब ने एक प्रकार से भारतीय वायुसेना के सामर्थ्य और अद्भुत कौशल का परिचय दिया है। मैं एयरफोर्स के सभी साथियों को बहुत उनकी भूरी प्रशंसा करता हूं।
The unprecedented rains this year caused heavy floods in Assam and Meghalaya in June, followed by Madhya Pradesh and Rajasthan in August. The timely response by the Air Force, along with the national and state disaster response forces, helped in saving many precious lives. The Indian Air Force and Indian Armed Forces are always committed to be the first responders for the humanitarian assistance and disaster relief operations, whether in the country or abroad. True to
Keeping up with this spirit, I shall cover my presentation under the following heads: give you a brief historical overview, talk about the Air Force capability, the need for coordination and collaboration. I'll quickly run through a few case studies. We look at technical augmentation, the way ahead before I conclude. Most important thing in this entire disaster relief operations, time is of essence. The National Disaster Management Policy approved by the Union Cabinet on 22nd October 2009 acknowledges the role of the armed forces in disaster management and states that the armed forces are called only when the coping capacity of the civil administration is exhausted. It, however, admits that in practice, the armed forces are deployed almost immediately to provide communication, search and rescue, medical facilities, and transportation by air. As you all know, the disaster management cycle is as shown on the screen. However, the armed forces are usually called in at the response stage when the effect starts to take place. Most of the disaster relief operations involve the initial reconnaissance, airdrop of aid, which is almost immediate, air transportation of personnel, material, and supplies, and aerial evacuation by the Hepters and other medium-lift aircraft. When we look at certain international disasters over the last few years, the Air Force has participated in almost all of these, giving relief to friendly foreign nations. During these crises, many complex problem areas arose, but as they progressed, the Air Force learned valuable lessons and employs them even today in any future missions that come across. The IF's reach with its main aircraft, that is a fixed-wing aircraft of the AN-32, has a range of about 1,200 nautical miles. The C-130, the IL-76 with 2,200 nautical miles, and the C-17 about 2,800 nautical miles, gives you a coverage in one hop to cover almost the entire of Middle East, Europe, and Southeast Asia. Overseas HDRs are usually of short duration and limited scope. They are based on the requests of the host nation and the capabilities of foreign aid agencies and military forces. The execution, however, though complex, is similar to executing a military operation. Foreign forces are usually involved in the immediate life-saving phase, until and unless the host nation and the international community can thereafter sustain the requirements and continue with long-term rehabilitation and reconstruction. Hence, it is incumbent on the participating foreign forces to evaluate its role and equipment in the host nation to maximize its effort. Overseas HADR are far more complicated. Addressing these out-of-area disaster contingencies requires a thorough knowledge of the platform to be used, to optimize it, be clear of the command and control structures, and also address the challenges of complex interagency coordination. When we look at the national disasters from the 80s to 2010, we found they were little less in number, though affecting almost each and every part of the country. But over the last 20 years or so, you find that almost all parts of the country have been affected by earthquakes, cyclones, and floods, not to mention the COVID-19 pandemic, which was rampant across the country. A look at the Air Force capabilities in terms of the various aircraft and platforms that we have. The IF fixed-wing capability includes the transport assets of C-17 IL-76, C-130, AN-32, C-295, the Avro, and the Dornier. In this, the medium and short-range aircraft are used primarily for small load of passengers, casualty evacuation, whereas the heavy aircraft of C-17, IL-76, and C-130 are used primarily for mass airlift, long-range missions, and ambulance modifications. A look at the rotary wing capability. Helicopter assets include the Chinook, Mi-17s, ALH, Chetak, and Cheetah. And in terms of capability, the Chinooks carry the large loads, the Mi-17s carry general loads, the ALH lands in areas which are tight and have less rotor clearance. The Chetak Cheetah obviously carries light loads and used primarily for casualty evacuation. Shown on the screen is gives you an idea of how the airlift capability of the Air Force pans out. It works out from about 75 tons per sortie in the C-17 to about 500 kgs in the Chetak. Coming to the passengers, it can take about 225 passengers in one sortie for the IL and down to about 2 passengers for the Chetak in the casualty evacuation mode. So to summarize, the Air Force has enough platforms, both in fixed and rotary wing, which can carry out all types of missions as per the requirement of the area and as per the requirement of the role that they have to play. The primary roles for which the Air Force gets called in is the search and rescue, evacuation of casualties, time-critical transportation of aid, and aerial distribution of supplies to the affected people. The additional role of firefighting by helicopters have added a new dimension in dousing several forest fires, as demonstrated in Sikkim in 2017 and in Tamil Nadu in 2018. The Bambi buckets are capable of carrying almost 5,000 liters of water in underslung mode. Here is a small video of how the Bambi bucket works. Having seen the roles of the Air Force, let's now run through a few case studies. But before that, something which will interest most of my medical friends who are present here. The Air Force also has something known as the Rapid Action Medical Team. This is trained to be ready within 12 hours and is prepared to tackle 3 contingent scenarios, rapidly building up the capability to provide medical care at the stricken areas. This goes a long way in saving precious lives. The Rapid Action Medical Team is air transportable. It can set up its own dispensary and be equipped with a 25-bed hospital with an operation theater. Most of the HADR missions undertaken by the Air Force work on the hub and spoke model, in which the hub, which is the feeder airfield or the main airfield, is provided by aid by heavy lift aircraft, the bigger aircraft, which bring in supplies. From the hub, the Hepters and the smaller aircraft move the supplies and the relief material to the far-flung areas or the affected areas in the spoke concept. This methodology is very effective, was found very effective during COVID, and is used by most of the forces across the world in disaster relief operations. Let's look at some case studies. The earthquake that struck Kathmandu was 7.8 on the Richter scale. It killed over 8,000 people and injured over 21,000 people. It was considered as the worst disaster in Nepal since 1934. When the Air Force was deployed, it moved in quickly, moving relief material to the affected areas, and in excess of 500 tons of aid was airlifted and provided to all these areas. The Air Force also ensured the evacuation of over 43,000 Indians and foreign tourists. The kind of aircraft deployed is as shown on the screen, from the heavy lift C-17 and IL-76 right down to the ALH and the Mi-17 Hepters to bring in people from far-flung areas to the main landing grounds. There were various operational challenges that came across the way. First and foremost was a congested airport and airspace, because when the aid started coming in, everybody came in the same time frame. Also, the single runway of operation made it very difficult for people to move in and out. There were extended flight delays, holding of aircraft, and on some occasions, aircraft had to divert back because they did not get landing space and landing slots.
Harrowing scenes in the earthquake-ravaged Turkey and Syria. Round-the-clock rescue operations, and the death toll increasing every minute. Turkey is living its worst nightmare. But in this time of need, India stands with Turkey. Its historic Operation Dost mission is ensuring relief to the earthquake-hit regions, providing every possible help and showing the world the real meaning of Vasudev Kutumbakam.
The nation of Turkey occupies a unique geographical position. It acts as both a barrier and bridge between Asia and Europe. This area is prone to earthquakes as it lies at the intersection of three of the tectonic plates that make up the Earth's crust. On 6 February 2023, a 7.8 magnitude earthquake struck southern and central Turkey as well as northern and western Syria, followed by a 7.7 magnitude earthquake within 3 hours. The devastation was widespread and over 59,000 people died. The extent was so severe that the Turkish government declared a level 4 alert to appeal for international aid. Towards this, Operation Dost was launched by India. The first IEF C-17 took off at 0310 hours on 7th Feb 23 from Hindon Air Base, which was approximately just 12 hours after the earthquake had struck, making India one of the first responders to this disaster. These aircraft carried NDRF squads, mobile hospitals, and relief material for rescue operations in the affected areas. The Air Force airlifted over 180 tons of load, 151 for Turkey and over 29 tons for Syria. The lessons learned during Operation Dost were invaluable and reminded us of the vulnerability of our geography and importance of always being prepared. Let us now quickly run through the last case study of tsunami. On 26 December 2004, the tsunami that struck the Indian Ocean, comprised of waves that were up to 55 feet high, spread across 1,200 kilometers when it hit the coast of Sri Lanka and India. The Richter scale had touched 9, making it the second largest earthquake in recorded history. The death count was in thousands, and devastation to island territories as well as the coastal mainland was irretrievable. In the aftermath of wide-scale destruction, in addition to providing succor to its own, India was quick to extend help to Sri Lanka, Maldives, and Indonesia, wherein the first relief package was en route Sri Lanka within 12 hours of the disaster, and full operations in all countries within 3 days. The IF, accustomed to disaster response, launched Operation Sea Wave. Various aircraft, including the C-17, the IL-76, AN-32s, Hepters, and Dornier aircraft were launched. The relief operations were divided between the mainland and islands. The urgency of island relief prompted massive airlift operations using all our aircraft. Distinct operations like Rainbow for Sri Lanka and Castor for Maldives were launched. These exemplified the multifaceted relief approach. The operations involved helicopters for CASEVAC missions, distribution of supplies, and deployment of medical teams. Having touched upon the case studies, now let's just look at the disaster management setup in India itself. The DCMG acts as a link between the national response and the defense forces application during a disaster. As per the doctrine, the armed forces are employed on the principle of first in, last out. The concerned committee under the Air Force at various levels are as shown on the screen. The DCMG groups forms under headquarter IDS, which is under the aegis of the MOD. Under the DCMG, you have the cell at DMCC at Air Headquarters, and a further delegation down to the command headquarters as Command Disaster Management and Coordination Center. The CMDCC reduces the response type of the Air Force and it percolates down to its designated level, which organizes a cohesive team. Open lines of communication are maintained with all stakeholders. Thereafter, the mobilization takes place, which is heavily reliant on integrated logistics. This process is ongoing and continuous and served as a closed loop to ensure timely feedback and instituting corrective measures as mandated. The speed and mobility of air assets makes the Air Force a natural choice to all HADR operations. India's topography makes us a disaster-prone country. This was covered earlier by some of my speakers. The Himalayan region in the north, riverine plains, coastal areas, ghats, jungles, all of them make India prone to very many disasters. In fact, as per the UN Office for Disaster Risk Reduction, India ranks up high among China and USA in the number of disasters. Therefore, it is crucial that multifaceted training is imparted to ensure our readiness to any kind of disaster. Every disaster is unique, hence the mandate to have a different approach and a new solution. Ranging from high mountains in the north, you have the snow-covered hilltops, high altitude posts, and small dispersed islands. The reach of the armed forces is in all these places. The characteristics of air power allow IF to be best suited for this purpose, since all disasters require timely assistance. Swiftness of approach makes the service well suitable for this purpose. The factor of flexibility and versatility allows the same platform to be used for multiple roles, which is that if an helicopter is employed in evacuation roles, it will also serve as an airborne platform to do search and rescue or act as a fuel bridge at the same time. Most importantly, the aerial asset possesses the capacity for concentrated and accurate delivery closest to the afflicted areas. Towards this, regular training and tabletop exercises are conducted. These include the NDMA, the SDMA, government agencies, CAPFs, and sister services. All personnel are given real-time training to operate in local area, and the equipment is scaled according to the threat envisaged. The various types of training include underslung load, delivery to remote locations, winching operations to save stranded people, and combat onload and offload to deliver maximum supplies in the minimum time. Needless to say, the nature of calamities is such that the relief required is imminent and time sensitive. Therefore, there is no time for orientation, and information gathering is on the go. As brought out amply, each disaster is unique, therefore there is no set template to address it. Since communication lines are the first to suffer, there is no reliable and complete feedback process for the ongoing missions. The secret of success of the armed forces is sheer discipline, continued training, and the will to achieve the objective even in the face of adversity. This is what makes a difference in the face of disaster. The primary operational challenge faced by the operating platforms are inclement weather, varying terrain, shortage of fuel, and failure of logistics lines. In several cases, the operating services themselves are damaged and administrative support is very limited. These constraints are mitigated by the Air Force using its expertise in setting up and managing airfields and landing strips in affected areas. In many disaster-prone regions, the Air Force has established well-equipped air bases and forward bases to enable seamless preparation when required. These bases serve as hubs for coordinating the disaster relief operations. Having looked at the wide spectrum of HADR operations, some of the challenges that we have learned are as flashed on the screen. The importance of ever being ready can never be overemphasized. Always be prepared is the motto, and integrity in the name of humanity amongst nations goes a long way in achieving this. The evolution of HADR operations is likely to be revolutionized by the advent of modern technology advancements. Futuristic technology will play a crucial role in providing immediate response and augment the HADR efforts. Shown on the screen are some of the latest technologies which are available to augment disaster management efforts. Having seen these latest advancements, some of these which can be inducted or included in the Air Force are as shown. Artificial intelligence can handle supplies, air traffic flow, survivor identification, and information dissemination. Autonomous drones, which is a rapidly growing fleet, can improve the capacity in mapping, imaging, survivor identification, and relocation process. Infusion of these technologies and innovations will further improve the Air Force's effectiveness as the first responder, always and everywhere. As per the joint doctrine of the Indian Armed Forces, one of the national military objectives emanating from the national security doctrine is to be prepared for contingencies at home and abroad to render HADR to civil authority and international peacekeeping as and when called for. The IF prides itself in its continued effort to implementing this mandate and plays an irrepressible part in providing HADR during trying times. The Air Force performs the role of an airborne guardian which responds rapidly, effectively, and with unmatched efficiency. With its inherent culture, prompt response, training and resources, it is well placed to play a major role alongside other state and central agencies that perform this vital role in any disaster. The IF's past and present is bejeweled saga of empathy, courage, and professionalism, extending an arm to those in need as and when called upon. I leave you all with a small clip.
Warriors by instinct. We are known as Apatsum Mitram. We, being the first responders, have always been at the forefront in providing humanitarian assistance and disaster relief, both within and beyond our borders. As an earthquake struck Syria and Turkey, we airlifted 510 personnel and 307 tons of relief load under Operation Dost. Similarly, as part of Operation Kaveri, we rescued over 2,000 personnel, including 67 foreign nationals from the conflict zone in Sudan. Our warriors led firefighting operations across different parts of the country. Even Cyclone Biparjoy could not deter us. Our air warriors demonstrated exemplary courage and compassion. Rescuing the injured and stranded from high altitudes, they enabled immediate medical access to the remotest of the regions. When heavy rainfalls affected the state of Himachal Pradesh in the month of July and August, the IAF flew over 226 sorties spread over 115 hours of flying, airlifting over 1,300 citizens and providing over 40 tons of relief material.
Thank you.
Thank you, sir. It was a very, very well covered presentation as far as our role in HADR ops are concerned, with specific reference to the kind of service which the Indian Air Force has always been undertaking. There's a question, sir, which I would request you to take on, sir. Please.
Yeah, please. Thank you. Thank you.
So since you're here and you've had such a vast experience, we would like to discuss a problem which our state is facing. Properly, if there's a solution. As we were discussing in the session, just before the session also, that the first heli emergency medical systems of India is going to be launched from AIIMS Rishikesh. So I was in the working group of it for the medical part. So one place the working group was stuck was, it's easy to find places from where to take off, right? The problem is, where do we land? Because it's not planned, right? Disaster happens in places where sometimes access is not there, there's no flat land. And since it is a system, hence, Air Force has a training definitely that you can hang in a wire, send somebody down, pick it up from there. But to make it a common system, an easy system in a civilian setup where there are no big projects like Operation Dost and amazing projects, but small sorties, right? Somebody had a cardiac arrest, somebody had a trauma, had to be taken 5 sorties a day, 10 sorties a day. So what we had to resort was, what the team actually had to resort was, we'll just fly to the places which have places to land around. So we identified for example, a school is nearby a district hospital, so nobody can call us directly. So it has to be those hospitals where patient has to reach and they have to connect to us, and then we airlift. But the golden hour is gone in these times. If you want to save lives, if you want to difference. So is there any solution for it so that patients can directly call the central helpline and chopper can be shifted to that part and lift them up with the capabilities the civilian people might have? Of course, I know that Air Force might be having such. Is there a solution for it?
Let me put it this way. What you're talking of now is a transitional shift in the mindset of how we do medical evacuation, or how we treat our people who need that critical care in that golden hour. First of all, any kind of medical evacuation by air is an expensive proposition to start with. We'll talk of infrastructure later. If you talk of a common man who wants to requisition a medical airlift, on his personal count it will be very difficult, because there will be a lot of loop that he has, lot in the loop that he has to cover, apart from the costs. But if it is institutionalized, say from the state government or from the Air Force, then at least the cost part or the logistics part is sorted out. Then what we need to institutionalize is a mechanism to have a centralized calling and a mechanism to approve that flight to go pick him up and bring him to the nearest care center. From the point of view of execution of that sortie or the mission, it's not difficult. Military pilots, and I say military pilots, which includes the Army, the Air Force, and the Navy, are trained to hold an aircraft in air without landing. They can hold the aircraft a few feet above, so that even if there's no, you see, for a landing, you need some strength on the ground, because the weight of the aircraft has to come on that. Sometimes you don't get that. You don't get the space. It is rocky. It is soggy. It is at an angle. Aircraft cannot land. So he hovers. But that is adequate for the patient to be put inside and carried back. It happens regularly in the northern frontiers that we operate in. And it is not difficult for even a civil pilot to do it as an air ambulance as well. The requirement would be for somebody trained enough to put the patient in properly and get him out from that place to the closest place where you can give him care. Landing of a helicopter is not a problem when you started that, and I'll tell you why. First of all, the size requirement is very less. The helicopter pilots, and we have one here amongst us, they are very ingenuous. You just need to give him a small square piece of land, maybe a football ground, a university ground, or some place, he can put the aircraft down when the requirement is critical. Okay. So for the HEMS that we were talking about, for it to be successful, there has to be a mechanism at the government level, state or central, wherein when a person calls a helpline and says, I need this medevac, it should be approved by the concerned authorities, the district magistrate or the district collector, in the shortest possible time, giving an indication or a go-ahead to the pilot to go pick him up and bring him back for care. The institutional setup has to work. The execution is not a problem. That's my take on that.
So actually, just interrupting, sir, because these are the things which have already been taken care of. For example, this is a funded project, Ministry of Civil Aviation's, Government of Health, MOHFW. SOPs are in place, administration's permissions are taken beforehand. No permission at the time of evacuations. AIIMS Rishikesh is going to be the center. The catchment area is going to be 100 nautical miles from AIIMS Rishikesh. So the funding part is clear. Moreover, it is included, I mean, again, that committee which is drafting the 48 hours cashless in Uttarakhand, that too included in private. The pre-hospital care is included there. So funding part has been taken care of, permission part has been taken care of. We know about the Himachal thing, but this is the Government of India thing, which is the second stage has to be rolled up in Dibrugarh, Assam, and thirdly, Dr. Usha Padi, who was the civil aviation, she's trying to get it into Orissa as well. So that part is clear. The problem is, we know the capability of the Air Force. I mean, no doubt about it. For such thing to happen at a very large scale, 4 or 5 sorties a day, and that too by civilian population, by people who are not trained day in and day out like you people. You know, these are pilots who are civil pilots, and then we don't have that capability that somebody goes down the rope, picks it up and come back.
All these Hector pilots which you see in Dehradun are all ex-Air Force and ex-Army. The capability is there, the assets are there. You have to just do a MOU with them. You do a MOU with this aircraft which is flying in Dehradun. I'm sure he will pick up from anywhere. That winching operation what he has shown is not required in civil case unless it's a disaster where the aircraft cannot land.
Talking about. Let's just understand that. It was covered very nicely by Brigadier Upendra in the morning. The role of the Indian Armed Forces is to protect the nation's integrity, to fight the enemy at the border. The secondary role is aid to civil agencies as and when asked for, and the caveat is it's usually in disaster because the civil administration is supposed to cater for such exigencies within themselves. They have been set up. They've got funding. They've got teams. They've got raisings. So that is not the primary role. Okay, please understand. Therefore, when a person has a cardiac arrest or something, yes, life is important. I'm not contesting that. But who should do that? It should be somebody from the civil administration who should do that. Now, whether he does it by a high-speed ambulance, whether he does it by drone sending an AEDS, whether he does it by a Hepter, that is the administration to decide. You cannot involve the armed forces on this kind of role because then the main role will start suffering. So that's where you got to draw the line. In fact, a few years back, the parliament had, there was a committee which sat down and they said that there has been an over-involvement and over-dependence on the armed forces on every small crisis that happens. So it starts suffering, it starts having an impact on the operational edge of the armed forces. We are not here for this kind of work. We support the nation, but our main job is somewhere else. And therefore they said, the way forward is that support and strengthen in-house mechanisms, support and strengthen the civil administration, support and train your first responders, which can be the police, the medics, the doctors, the collector and his team, etc., etc. So it has to be a two-pronged approach. It has to be a two-pronged approach. There is an awareness. There is an understanding. There is a broad agreement. Yes, we need to bring up this side so that the dependence on the other side is less. But then be rest assured, when the chips are down, the armed forces are there. They're going to come in. But don't think that you could start using them for a daily requirement like this. There, the state has to gear up. There, the state has to gear up. Like, just a quick point. How has Delhi become so effective, or NCR, in all these medical emergencies? They've got a large fleet of CATS ambulances. Large fleet. So they have said, okay, we will do it by road infrastructure. May not be possible in the hills. Heli is a very good methodology, but it has to be done at the administration level. I hope I'm able to answer your question.
And moreover, sir, it's in the countries where we have this facility, everything is outsourced.
Yeah.
So
armed forces, that's true. That's true. That's true.
They are coming after India is giving such policies. In 4 to 5 years from now, I think this will come a reality. What sir was saying.
Yeah. Yeah. Thank you. Any other questions?
After having heard A. Commodore Lamba, we'll just cover in very brief how the army also pitches in along with Air Force in carrying out our assistance in HADR operations. Even though the presentation was supposed to be for about 90 minutes, but now that the time has been curtailed to just around 20 minutes, we'll just be taking on the methodology of the Army's involvement in HADR operations through certain case studies, which I request Colonel Hemant Devlal, CO 11 Kumaon. He is from Pithoragarh, and he's also been actively involved in a lot of HADR operations, presently commanding his battalion in Solan. So he would be talking about the methodology of the Army's involvement in carrying out HADR operations.
Good evening, everyone. I'm Colonel Hemant Devlal. I'm currently commanding an infantry battalion in Himachal, just coming over there. Now, since our presentation already covered in the morning, Brigadier Upendra, I think I'll be on this. In the morning, Brigadier Upendra has already covered the role of the Indian Armed Forces in the various aspects as part of the HADR operations. We were supposed to cover initially a few of the case studies where the Indian Armed Forces have been actively participating. However, post Commodore Lamba's presentation, I shall just be dwelling more on the part of how Indian Army actually carries out its methodology on ground. The role of the Indian Armed Forces in HADR operations remains steadfast, remains committed. It is still same even after the enactment of the NDMA Act, because of virtue of its presence at each and every part of the country, as mentioned earlier. By the very nature of our presence, we become the inherent first responders for any disaster which is occurring. I intend to cover these things, but before that, since two of the tragedies which the state has suffered, that is Uttarakhand, so I just wanted to bring out why and how the army actually functions in these kind of scenarios. When we talk about the state of Uttarakhand, we all know for the past 3 days, you all have been, there are many esteemed panelists in the gathering who have been speaking on the that is the geology as well as the topography of Uttarakhand, which contributes to its sensitive nature, which contributes to the various disasters which have been occurring over a period of number of years. So when we talk about Uttarakhand, it constitutes the young fold mountains or the Himalayas, which are tectonically active, they are fragile, and because of the plates which are constantly in motion, it's causing earthquake and landslide. Much of the thing I'll not dwell upon. When we come, these leads to various kind of natural hazards. For the past many years, we have been seeing the earthquake and the landslides which are common in our area. Now, Uttarakhand per se, it is part of the state of Zone 4 or Zone 5 on the seismic notation map, which is one of the, I'll say, in mid or higher level of alert. When it comes to the monsoon and the rainfall, the state experiences a significant increase in the rainfall from the month of June up till September. In various districts, the rainfall increases. The percentage of rainfall over a period of year has been increasing, and there has been what has been seen and had been given by the IMD is that this is leading to either the flash floods or the cloud bursts, and which causes floods. Now, inferences which actually come out is the maximum rainfall is in the month of July, followed by August, and if we see overall, so there are two districts which all together, that is Chamoli and Tehri, which experience significant rainfall in the entire monsoon area. Now, what does it necessitate? It necessitates that among the hill states, Uttarakhand and Himachal Pradesh, these two hill states, it requires the presence of the forces for the HADR operations. The first is because of the number of religious shrines, because of the number of tourist destinations, the flow of tourists in this state is too much. So at any point of time between June till September or even after that, there are a number of people who are in sensitive or ecological areas or in higher reaches of mountains which are prone to landslides, which are prone to or susceptible to these kind of disasters. At the same time, these rainfalls, they cause havoc, disrupting the entire communication system, disrupting the entire infrastructure. Again, which I mentioned, the Himalayas being part of the Yangful Mountains, they are prone to these kind of slides. It leads to the disruption of the infrastructure and requirement of launching the operations. The cloudbursts as well as the flash floods, they call for the employment of the ground forces at a very, very short notice, and the task forces, that is the IS columns or the flood relief columns, which are employed for the HEDR task. In addition to this, the high-rise mountains of Uttarakhand, very typical, they attract a number of mountain expeditions, which are basically generally glaciated or snow-capped, and at times because of this disruption, these expeditions or the parties get trapped and they lead evacuation. So armed forces in all these scenarios, they are requisitioned for reactive scenarios, that is search and rescue missions. Now, how exactly are we leading to this? I'll just dwell on this more now. I'll just take the example, as you are all aware, Uttarakhand basically has got two divisions, that is the provincial divisions. One is the area of Kumaon, the other is the area of Garhwal. Now Garhwal, out of these, the entire state is divided into 13 districts. Now if we just take the example of the Garhwal region per se, so any ground force that is an area has been divided by the army into various sectors. Now these sectors may have the geographical affinity of the district, or it might not be. However, the geographical landmarks or the physical landmarks are generally used, and this particular way we are able to give responsibility to nominated units or nominated sectors. For example, the area of Garhwal, if I say, has been divided into these areas, basically Tehri Garhwal, Uttarkashi, Rudraprayag, and Chamoli, which is far more inaccessible, far more prone to these kind of disasters, has been further divided into 3 more subsectors, like Chamoli to Joshimath, Joshimath to Malari, and further Joshimath to Mana. Now, between these sectors, certain columns have been divided by the army, or they are kept in reserve. For example, 10 to 15 columns, including reserves, have been earmarked, kept on ground, and ready, or I'll say standby if requisitioned. Now, when we talk about a column might be of infantry, that is the ground troops or the artillery, along with the other specialized elements. What do? They basically are earmarked for the particular sector. They are responsible for carrying out all the coordination, and they carry out the necessary coordination, necessary training, the liaison with the civilian administration during non-disaster period, that is the non-disaster phase. And the unit during this entire period carries out the liaising part, the numbers are shared, and when requisitioned, the ground troops, these are with the specialized elements, especially the medical, engineers, the recovery elements, and the communication equipment, generally having strength up to 70 to 80 per column are earmarked. Similarly, the engineer task forces, which are again specialized columns, as you would have seen in the stalls today, with the specialized equipment like BAPs, that is the boats, and the other equipment which are there with them, these columns get mobilized. Now, apart from these, other specialized equipments available with us will be the ambulances, water bowsers, which are required during the period of disaster, which are mobilized on short notice. Now, how do we actually work out? In any case, a disaster, such kind of scenario, the quick response teams, which are already earmarked, they are mobilized at short notice. These quick reaction teams generally have an officer as a column commander. About 25 troops are earmarked. The signal operators for providing the communication services, the engineer representative for giving the engineer or carrying out the engineer assessment or the data profiling are part of these teams. In addition to this, to provide the necessary wherewithal of the medicals, the medical team consisting the NAs, the stretcher bearers and the ambulances are as made part of this. So this is the first column which gets launched. What does it do? The column basically gets launched. If possible, it is heli landed. If possible, it is dropped, or otherwise, when it reaches the location, it carries out the initial damage assessment. After setting itself up, it makes a control point, it makes a control center, and passes on the relevant first-hand information from the ground. Once the information has been received within a cycle of 2 to 4 hours, the balance parties, they are dispatched and the action starts. Now this column per se is administratively self-sufficient for 3 days, and within these 72 hours, the balance party fetches up with the necessary wherewithals. Now, in the entire response mechanism, the fundamental principle for the Indian Armed Forces, when I say Indian Armed Forces, it constitutes the 3 services, it remains the same. Whether or the requisition has been received or not, the principle remains the same, that no loss of life should undertake or for want of clearance or a requisition by the civil administration. So irrespective of the requisition being received or not, if the local commander or the local commander feels he needs to act, he can act, and the incident is reported and the troops are deployed on the ground. However, in the requisition has been forwarded by the civil administration, concurrent actions take place at various stages, that is at the level of the headquarters as well as the ground troops, and the mobile disaster relief teams are dispatched to carry out their tasks. Now, post the evacuees have been received at various locations, the staging areas are set up. This basically includes the initial reception areas, which are generally earmarked during the rehearsal or the recce phases. These are generally the government hospitals or the government infrastructures or the schools or even the religious centers which are used. Once these evacuees have been received, they are initially given their medical treatment. They are further evacuated using the civilian administration or the services which are possible. Coming on to the essential requirements, these are basically the food, shelters, medicals and repair and recovery wherewithals which are provided by these columns in consonance or in coordination with the civilian administration. But at the point, all assistance which is provided by the Indian Armed Forces based on the requisition is reimbursed by the state government to the Minister of Defence. Now, coming on to when we mention about the part of Uttarakhand per se, so I'll just dwell on the first tragedy which the state suffered in the year 2013, the Uttarakhand flash flood. This was one of the massive events which the state suffered, and it was at the scale of tsunami post 2004, and in between no other events is of this magnitude. Between 13th to 17th of June 2013, the rainfalls in the general area of Chorabari, they were unusually high. This led to a gulf. Basically, the Chorabari glacier, it melted down. The Mandakini river overflew, as you all are aware of these incidents. And however, the early warning which had been received by the IMD, it had been ignored because there were no unusual signs which were observed. But this led to what? An area of more than 40,000 square kilometers was affected, and altitude was more than 10,000 feet. Now, 70,000 tourists, which I earlier mentioned, were only in this area, and more than 1 lakh locals which were affected directly. If we see 13 districts constituting more than 1,600 villages got affected overall. And ultimately, when we see this operation or this tragedy, 680 people lost their life, 4,000 got missing, and 2,000 houses damaged, and more than 8,800 livestock in this state of Uttarakhand, which becomes the base for the economy, were lost. Now, it was one of the major rescue operation which was conducted by the Indian Armed Forces, and when we say how exactly it got conducted, it was in the name of Operation Surya Hope. As I mentioned earlier, the entire area which had been divided into certain sectors came handy. So in similar manner, in Operation Surya Hope, the area had been divided, and it was further divided for the various columns to be launched. They provided the necessary wherewithal or the assistance. Initially, Prior to 13th of June, it was as part of Operation Ganga Prahar, which was renamed by the Indian Armed Forces as Operation Surya Hope. Between 19th to 23rd of June and later, these were the various phases where the operation had been conducted. I'll just move forward. Overall, if we see the effort which had been provided by the services, and when we say the armed forces, total of 24 medical teams, the psychological specialist team 2 and the SHO teams 1. Army contributed more than 8,500 troops in various teams. Navy provided 2 Marcos for the deep diving to search for people who were trapped in the lakes and the rivers. And Air Force, as mentioned earlier, had provided the airlift capabilities, providing more than 3,700 sorties, and total 24,000 people had been evacuated. So altogether, Operation Surya Hope contributed in evacuating more than 1 lakh these people who were trapped in this area, who were rescued and evacuated either through foot or through tracks or helicopters in these 14 days. Similarly, Tapovan flash flood in 2021, you are all aware of this, it was because of the glacial, the Glof, which happened in the general area of Rani village and Tapovan. It led to a massive flowing of the river, that is the entire area, and Nanda Devi glacial burst caused the hydropower projects which were there in the area were washed down, and the villages in the vicinity were evacuated. Total 200 people lost their life in this tragedy. This is the local formation which was in this area, which was immediately called for, and they acted. I just don't want to dwell on the part of day-to-day activities. However, what we know that they were able to recover even post during the rehabilitation phase. They helped actively, and the unit was involved in recovering the bodies which were trapped inside the tunnels even after 14 to 15 days. This was the total efforts which were provided by the Indian Armed Forces in various levels. Now, the part of tsunami has been already covered. I will not dwell on this much. This is the relief effort which had been provided as mentioned by Air Commodore Lamba. At the international level, since it has been covered, just for the part, the efforts which are there, we'll just come to the efforts. The field hospital constituting of 99 members was set up in Turkey. It was able to provide about 3,600 casualties were treated by the minor procedure, major surgeries were conducted, and in addition to this, using the NDRF, by the support of the Indian Air Force, India became one of the first responders amongst the world to be in location. This was as part of our core ethos of Vasudhaiv Kutumbakam, which we have been able to prove, and I think India is emerging as in the neighbor countries or the areas which are in close vicinity, we are emerging as one of the first responders. I'll just come to the last part since time is of essence. So, what exactly is the way ahead? When we come about the part of Indian Armed Forces altogether, we know as part of our preparation and training on a daily routine basis, there is something inherent in us. We keep on preparing for the eventuality which will happen one day. However, that is not expected. That is considered that it should not happen. However, we prepare for it. So, the efforts on the ground, that is which we, as part of our training, our efforts are synchronized. Our resources are integrated. We carry out rehearsals with the civilian administration, thinking that the day when such an eventuality occurs, we'll be able to use it. Similarly, all the defense-related infra which are there in the border areas, they are in consonance with the DRR, which is the general strategy for the same. The Gati Shakti projects which are currently being aligned, they have been already aligned, and all defense-related infra is being aligned to them. There is already a EV drive taking place in Indian Army. As mentioned earlier in the morning by Commander, the Eco Task Forces or the TA battalions, they are taking an active part in all across India. There are altogether 10 battalions which are working with a number of companies. They are basically carrying out afforestation drives, the cleaning of the lakes, plus this cleaning of river Ganga and all. Similarly, the national standards which are part of all the projects in the civilian, they are already have been constituted or they have become part of the Indian Army, I'll say over a period of number of years, like the water recycling, water rain harvesting, solarization, the incorporation of the Graha norms, the strict ban on these single-use plastics. They have been incorporated as part of our MES, that is the buildings which are being constructed by the MES, and all these norms are being used over there. When it comes to the Amrit Sarovar project as part of the national effort, Indian Army or Indian Armed Forces are taking active role in regeneration of lakes and ponds to catch the rainwater and prevent the direct flow of it. In addition to this, the preempting command and control structures in place and readiness status is there during any inclement weather condition. By the very nature of our presence in remote border areas, we are required to be prepared for all inclement weather conditions, and our SOPs percolate or which have been percolated down, they necessitate that we act only after those standard or the drills or the procedures which have been constituted as part of the SOP are followed up to the last point. Generally, the defense infra which is available in the border areas is being utilized. These generally are the transit camps or the transit points or the medical facilities which are available in the border areas. These are utilized for treatment or for reception of the person, even in normal scenarios. Or in case of any disaster, they become as the first responders, and these people are brought into these areas. Similarly, the space capacity available plus now the quadcopters, the drones which are available, they are used for search and rescue missions in any disaster these conditions. Now, what can be the future actions? What can be recommended is that the Indian Armed Forces, that is the 3 services, they are having adequately trained men. These persons could be deputed or they could be laterally absorbed into the HADR organizations. They are already trained, they have been preparing for various kind of calamities all throughout the years, they have been participating, and if they become part of these, that is the state of the HADR organization at the national level, it will constitute to these or strengthen the already, I think, the organizations which are there, it will strengthen them. Similarly, the subject matter experts like the engineers, the aviators and all, what was being mentioned some time back, which are available in the domain, having their domain expertise, they could be deputed to these organizations or at the civilian part just to strengthen the organizations. Also, the Indian Armed Forces outreach, which is already having by nature of our presence over there, can be used for disaster identification and mitigation. Already all our joint exercises, we are having this part of the diplomatic exercises which are there. So HADR exercises are being conducted with the countries. However, diplomatic agreements needs to be constituted with the HADR, for HADR with the neighboring region countries, which will help us out in mitigation, response and rehabilitation in case of any disaster in future. Also, like in the recently, like yesterday, what has the Silkyara tunnel, we roped in the Australian Mr. Arnold Dix from there. He's a tunneling expert. So similarly, in all the high altitude this terrain where HADR would be required, we need to identify people who are subject experts in various domains. We need to ready them and keep them in a way roster so that they could be roped in case, and that can be at the level of the international or national both, and they can be utilized in a short notice. Similarly, since this last point pertains to our, when we say it's very close to our heart, Indian Armed Forces are deployed in various altitudes and terrains. Now, over a period of last few years, or I'll say a decade or so, because of the spurt of tourism, now civilians have reached to areas where earlier these areas were inaccessible. Especially Uttarakhand is ecologically sensitive, Himachal is ecologically sensitive and I'll say area. Now the number of tourists who are reaching these areas, these places are bound to be more disruptive, or they will, in times to come, they will become more prone to disruptions. So recommendation is that all the policies which are there at the national level should be implemented for these sensitive areas, and it has to be strict implementation has to be enforced. I'm through, sir. Thank you. So when it comes to the Indian Army, it is not about the TA, sir. All the Indian Army, that is the various services, when we say, sir, whether infantry, artillery or engineers, they are trained for this disaster role in their particular domain, sir. We have earmarked columns which are nominated, which carry out rehearsal and practices, and our stores are earmarked for any eventuality. As I mentioned, sir, certain sectors are nominated, sub-sectors are divided among the units, and these units carry out the necessary license, necessary training, even with the civil infrastructure administration, and their resources are collaborated during the peacetime mode, during a normal disaster mode, sir. So this is the, not the TA per se, it is the Indian Army infantry and the artillery columns.
Actually, you see, war itself is a disaster. So we are always trained for, managing war, fighting war. So when that level of training is there, ingrained in us, this is a secondary role for which we are mandated in case requisition for. Like now my battalion is here in Birpur, Dehradun. However, there is a mechanism in place that before rainfall, I have to have at least 2 columns on standby in case of any flood relief which is to be carried out in Vikasnagar/Chakrata. So it is a secondary task which has been mandated to my battalion, which is stationed in Dehradun. My battalion will move out, but it is an operational requirement as part of the operational order for a battalion which is stationed in Birpur to be mandated to carry out flood relief operations if it happens in Vikasnagar or Chakrata. So as part of that operational order, there are systems in place, there are SOPs in place, which gives out the kind of strength, which gives out the kind of equipment, which is to be carried with this flood relief column. So if I may say that it is not that there is any kind of separate training which is happening. It is only preparation, and as part of the battle procedures of our inherent training, that these things lead to an effective response. So as what Colonel Hemant was also mentioning, prior to the disaster itself happening, there has been no flood in Dehradun. Dehradun has got a very good, I don't know, it receives so much of rainfall, but it just gets washed away and there is no water logging anywhere. So that's a very good thing. But if in case there is a flood-like situation, the floodplains are having so many houses and all coming up, so there are mechanisms in place. There is a team which is always going to be on standby. If requisitioned, we have our things geared up and we'll be there in the shortest possible time frame. So that is how it is.
Can face is a war. And what happens in war? Like for example, we have to go in forward areas, enemies destroy the bridge. So we have the capability to lay a bridge, and not in months or years, it is made in hours. So secondly, they disrupt our communication. We have the capability to improve or to make our communication so robust that it is not disrupted. then they target our storage, our ammunition dumps. So we have the capability to have multiple storage facility everywhere, which may not be totally stocked. So the capacity is there to absorb additional. Then when we go to the forward areas, we need certain acclimatization areas. We have our structures over there. So those structures can be used for kind of a refugee management in case people are brought in over there from various affected areas. So the capability exists. The manpower is trained to take the highest form of disaster, that is war. So if we are trained for the highest form of disaster, I think other disaster can be handled very well.
Thank you, ma'am. Sir, now I would request Commandant RAF, sir. He would be kind enough to come over and take the presentation, sir. I'm sorry, sir, I wouldn't know your credentials. If you can introduce yourself, sir. Thank you, sir.
Where to put this? Good evening, everybody. I am Nidhi Uniyal, Commandant 100 Battalion Rapid Action Force, stationed at Ahmedabad. So this is my second tenure with the Rapid Action Force. I'll just give you firstly the brief of Rapid Action Force, and then I'll come that what are the roles of RAF and what we do in disaster management. This is a specialized force raised in 1992, basically to combat or to as an anti-roid force with 10 battalions, and in 2018 5 more battalions were added here, and we have now 15 battalions spread all over the place depending upon the sensitivity of the areas. So we have 1 sector, 3 ranges, 1 training center, and 15 operational battalion. RAF is a part of CRPF, as we all know, and it is headed by an Inspector General. As I told you that the main role of, the primary role of RAF is right and to act in Reuters-like situations. The motto of RAF is to serving humanity with sensitive policing. This is very important to know that, because if RAF is deployed at any place, wherever there are Reut or Reuters-like situation, recently we have been we have been called for requisition to move to Manipur, and it was such many aircrafts have been placed from London and Chandigarh, and myself with my 4 companies, we moved to Manipur on IL-76 and C-17. So it is very important that wherever any riot is taking place, if we are deployed at the earliest, we will be able to control the situation. For that, sensitive policing, sensitivity is very important, because we are not fighting any external people. We have to control the situation with our own people. So the use of minimum force is the first main motto of RAF. This force was given its color in 2003 after completing 10 years of colorful service. We have been deployed in various other UN missions also, including Haiti, Kosovo, Liberia recently, and our teams are ready to move to South Sudan also. So I told you this is a basic role is to deal with communal Reuters and Reut-like situations. Then we have our secondary role also. The secondary role is to do disaster management, whether natural or man-made. As we know that only in 2005 some of the useful works done by RF is first when in 1992 our force was raised and the first deployment for a disaster or disaster-like situation was the Surat place. If you remember, in 1994, Surat was under plague and first deployment of RF was there. And our troops were getting trained and we were getting equipped, but our troops did a wonderful job in controlling or giving aid to the civil administration. Various other duties which we performed during as our secondary role is these which are there. Some of the socially useful works done by our troops is that whenever we go to visit villages, we give them basics of disaster management. As any force, whichever, whether it is Army, Air Force, NDRF, or any force, we are not the first responders. We call our first responder, but basically it is not the first responder. Because the golden hours are principle of four if we follow, are those. The first responders are we ourselves who is the bystander to us. If somebody has somebody get a cardiac arrest, the people in this will be the first, in this room will be the first responders. Okay, so everybody should be trained in the CPR or in the basic disaster management. And that is what is the motto, and we try to do community contact program and go to schools, villages, and teach basics of disaster management to people. So these are some of the photographs. Besides that, there are many other goals which are very important for the police forces and for RF also. As I told you that RF has been, before NDRF, we had our secondary role of doing disaster management, and we were equipped, very basic equipment were there with us, and 5 of our battalions were tasked to do CBR in emergencies, and 5 were for the special responses during the disaster management. And then our deployments were there in the Super Cyclone 99, Bhuj earthquake, Ahmedabad floods, Kerala floods, and many more disasters. We have, our men have been now trained, and after raising of NDRF, the secondary role of our had taken a back seat. But after disaster management plan was finalized, and all the paramilitary forces and army had been given role of disaster management as their secondary role. From CRPF side, RF is selected, and we have our manpower. We are training our men in our training institute, that is in disaster management wing at Coimbatore, and various other places also. With NDRF also, we are getting our men trained. Our teams are also trained for the mountain rescue, and these teams are deployed during Amarnath Ji Yatra, Vaishno Devi, and during glacial and cloud bursts, wherever our troops are everywhere. RF can play vital role in any stage of disaster management. So we have, I don't want to spend time on this, at any stage we can be placed. Where we can or where RF can play effective role is in the epidemic, fire, earthquake, cyclone, floods, house collapse, rail accidents, road accidents, boat collapse, all these accidents also we can play vital role. Our biggest strength is the strong and dedicated teams, well-disciplined manpower, and with the basic training offer in the disaster management and first aid response or medical response first aiders. How we can do is, what we can do is we can evacuate injured, sick, infirm, and children, transportation of food products, ration, water, medicine, dead bodies, and materials. In case of communication, we have key equipment, wireless sets, landline, wireless, and injured in accidents, recovery and security of valuables. It is also, these things are very important, and if these things are not taken care, the specialized team which are working at some place or at the point of collapse, it will be very difficult for them to continue with the special response. Maintaining of law and order, security of NGOs and relief agencies against looting and arson, guarding of FCI godowns and district godowns, distribution of food, all these are the important important works which are to be taken care during the disaster. Setting of langars and mass food kitchen, clearing roadblocks from slides, trees and boulders, repair of minor breaches of roads and culverts or any special response. These are the minor things which can be, and traffic can be made and can be made open for the bigger vehicles to fly. Then we have hygiene and sanitation, destruction of infected food and livestock, spraying disinfectants, protection of water resources, disposal of dead bodies and carcasses. So all these things also are important and has to be taken care for the proper control of disaster. Then we have trained manpower also for flood rescue. All besides other things, we have rubberized boats, though it is in very limited number, and we are getting it. And there is a big proposal under the consideration at Ministry of Home Affairs that all the disaster, all the RF units will have a specialized scale of disaster response material and stores. So those things will also be made available. And we, with the basic things, if the disaster in the larger scale, whatever locally available resources are there, those also can be utilized. So these, we have facilities for training in CBRN also, and we are getting our men also trained and getting the equipment also for the training in CBRN emergencies, which is there at our Coimbatore facility, and various other facilities also. We get time slot from DRDO, IMAS, BARC, and we have trained officers and men who have been trained in all these places for CBRN emergencies. Also at DRD Gwalior for basically for chemical and biological emergencies. During these are some floods, photographs of some floods and rescue wherever our men have been deployed in the past. So these are the basically some of the examples which I do not want to highlight, and we have been doing it. And after this disaster management plan have been finalized, we have again started our manpower in larger number getting trained for the disaster response. So these are the challenges: lack of coordination. We all know that we have different agencies who are expert in their own domain, but it is very difficult to bring all of them together and work as a team. So incident command system, though it is Indian response system is there, and if we all work together, all the agencies work together, I am very sure that we will be able to do our mitigation, do our disaster response in better way. Thank you. Somebody has any question, please.
I'm having, although I can ask you more, but sir, I'll use the platform here.
Okay.
So basically, armed forces and paramilitary forces, how they are coordinating with each other during disaster time? Because I think your strength is that you are dealing with the daily basis crowd management is itself is a disaster management, I think, and armed forces are dealing with differently. So at some point of time, do you have any coordination with paramilitary forces?
Yes, we have. We have We have coordination with the armed forces also. Whenever we are deployed parallelly, we have coordination meetings, and there is a in the label, if we are in a district, then district collector, SPs, all the forces commanders, our commanders, we all meet together, we coordinate our movements, and there is not much, basically there is no problem of coordination if we are structurally well coordinatedly deployed there. Like, I'll just give you one example of, I've just recently deployed with army also in Manipur clashes, ethnic clashes. We had 3 battalions of army also with my battalion, and we all were used to meet in the evening every day almost, and any coordination issues used to be addressed, and we absolutely had very nice coordination in Imphal and other places for dealing with the situation. And similarly, if any disaster situation takes place, there also we have very good coordination.
One more question from all of you present here in uniform. The technical part, you bang on the IMD or the scientific field, scientific fraternity, but when the disaster is there, because you people are there, scientists and we people, scientists are in a back row. So how much technical part you are taking care of? Remote sensing, GIS, something like that?
Sir, we like Sikkim, sir. All satellite imagery and GIS, like Lonak Lake, they used to share it with NDMA. NDMA used to share it with the PGS of that code. Then it used to be sent there, ki the what level is receding or what level. Everyone will be coordinating with each other. I'll coordinate with him, he will coordinate with me. Everyone will tell, stand by for takeoff, stand by for this, yes, cleared, light, it is lighted helipad now at night. So everyone is on the same pattern. It has improved in the last 4-5 years like anything.
Basically, WhatsApp has played a very big role in coordinating and meeting, giving us a platform. So any information which is immediately put it in the same WhatsApp groups, and we have different WhatsApp groups, and it is all the information from the specialized agencies is shared.
No, but one thing I'd like to add upon it, as in the US Army, even the SWAPO is a soldier is using a GPS and something that technically is know each and everything. So is in Indian Armed Forces.
Routinely to do all these coordination. So it is not only in the conflict zone or in the disaster zone. Now we recently had a SMAC meeting in Udhampur last month. So those mechanisms are in place wherein the regular coordination, liaison and communication between all the government agencies, including the central agency like Army, is being carried out. In that CRPF comes, everybody comes, all agencies they come. So that answers your question of the coordination part. Now second part is that what about the technical expertise and the technical know-how in the armed forces per se. I brought it in the morning also, the kind of technologies we have is much superior to what other agencies are having. We have our own satellites, we have our own satellite imagery. Apart from that, we have our own drones, like the only drone unit in the civil is the anti-aero drone which is located in Dehradun. And they are covering this area, they are covering northeast also. But we have drone units in every formations. So wherever we need a drone image, we get those images. then we have superior communication and handheld communications. Like for example, the OFC cable breaks, say for example, this Kedarnath, Sikkim, the entire OFC has been washed off. So we have these satellite terminals with us, and they have been deployed in all the remote areas. It's not that they are brought in there and then, because army is deployed all over. So we need robust communication, and we have 3 to 4 redundancy. If one fails, the second goes, the second fails, the third goes, the third fails, the fourth goes. So 4 redundancies are there. So we take care of the communication part in case any such eventuality helps. So when it comes to technology, GPS, now army, it's not a very new technology. Everybody is now, in fact, we are now switching over to IRNSS. GPS is now outdated. So whether it is positioning, whether it is information, whether it is communication, whether it is kind of a reconnaissance, we have all the means available with us. So in fact, as I brought in the morning also, armed forces are taken as the backbone for any kind of a rescue operation. For example, what Air Commodore Lamba had brought out, that it was their aircraft who took the NDRF to Turkey. NDRF did not go in civil flight. So it is a combination of all agencies. We cannot just go that only we are doing or they are doing or he is doing. Everybody is doing, but they're doing in a close coordination. So that coordination has been achieved by formulating NDMA. Earlier, the coordination used to be done by respective individual. Okay, if it happens in, say, Uttarakhand state, those state secretaries to do the coordination. If it happens somewhere else, so now there is a central agency who legislate, okay, who is going to do it and who is going to be the top, coordinator in this. So those agencies have been put in place in 2005, and that has helped us in coordinating our efforts. So there is no duplicacy of effort. Earlier, it was requisition to the army that we must also maintain certain stocks for disaster management, which was denied by the army because NDRF is there for that. They are supposed to maintain those stocks. In case they cannot transport them, then Air Force and Army comes in, or the Navy comes in. Have I answered your question?
Thank you so much.
This Congress itself is a prime example of coordination. Even though we had been roped in at the last moment, I am sure the way things are going on, the coordination is going to go much better from here on. I request Dr. Tyagi now to please sum up the proceedings after a long session now.
Myself, Dr. Ajay Tyagi. I am the Emeritus Scientist at Uttarakhand Council of Science and Technology under Department of Science and Technology, the Government of Uttarakhand. I would like to thank the panel experts from Indian Armed Forces to give enrich our knowledge in the field of this disaster relief management. And first of all, we feel proud on our Indian Armed Forces. They are safeguarding our nations and doing a very good duty for the nation to safeguard us. And also paramilitary forces organization for their internal security assistance to the civil administration. I will not take much time because everybody has throws their light of the knowledge in their specific field and covered almost all the topics regarding preparedness, how to prepare the disaster management and proactive approaches mainly. I will take short time to summarize all these things. First of all, I feel there should, just Brigadier Saab ne bola hai, कि there should be proper coordination in all the agencies, and commander should be one. So what I feel, that district administration should be in close coordination with the sub-area commander, so that if any emergency is there in the field of disaster management, so sub-area commander should take the charge and operations will take smoothly, because army is a highly disciplined force. We need that in that situation. So it is my just suggestion. Regarding technologies are concerned, so
apart from the old space-based technologies, now drone-based technologies are much more fruitful. If we say what are the disaster, we can broadly classify the disaster into two major parts. First of all, the tsunami, then flood, one part. Second part is landslides and earthquakes. And we know that our mountains are fragile in nature and very young in nature. So they need a different types of disaster management operations if we compare with the old mountains of Western countries. So I'll give a brief, short information regarding technologies are concerned. The latest technologies which I feel we should pinpoint the locations and zones which are prone to the disasters. We should not concentrate the full mountain and this. So, regarding technologies are concerned, I will suggest to the Indian Army that they should concentrate on the four technologies only. If, for example, I am taking the landslide example. The best technology is, earlier we have used LiDAR, laser-based scanning. But there's a limitation of each and every technology. So if we introduce the thermal mapping, because it may go to some fog and mist in the area, LiDAR has a limitation and it cannot penetrate the fog. But there are other limitations also. Dense forest. How I can see inside the dense forest? So there is now radar is coming, side aperture radar. If we use that radar, you can see inside the dense forest. And fourth is ground penetrating radar. Drone-based payload or ground-based. So with these four technologies, and fifth is ultrasound. Because ultrasound technologies can pinpoint where the stone is breaking, where the cavities are there. Ground penetrating radars can give you the insight where the mass precipitation of the water is there. So it will lose in the soil. So these 4 or 5 technologies are enough to know the exact zones of the landslides. And proper monitoring is also required, like ground-based radar. It may cover 1-2 kilometers easily, and very small cost. If you put a small inclinometer, it will give around 1 kilometer area information. If there is any deformation in the slope, alarm system should be there. So these are very cheap technologies are available nowadays, drone-based payload. So we should concentrate because space data is available on the Google. You can cross-check this. So my suggestion is that Army should focus on these technologies. So it will be helpful for terrorist elimination also, these technologies. Specific side aperture radar. And for example, we should also promote our traditional knowledge. The local community are much more knowledgeable about the disasters well in advance, where other latest technologies fail. Like I am giving the example. At the time of tsunami, at Andaman and Nicobar Islands, that tribals have gone to the hilly top areas well in advance. And they have not affected with the tsunami. Later people came to know that there is a small fish which is always in the bed of the sea, never come out to the surface. But if tremor is there, in rare cases, it will be seen on the surface of the water. Tribal knows this, but we don't know. We are totally dependent on the technologies only. Then safely they have gone well in advance, few days well in advance. So, and people who are using technologies, they suffered. So we should promote traditional as well as latest technology and find out the ways, technological and scientific base behind them. So I'm not opposing the modern technologies, but our traditional knowledge, the चूहा, the mouse का आपका भी example आपने देखा है, within 15 hours they have done the job, and all the machines have failed. So India have a very good knowledge in all the fields. We should combine this knowledge in a single volume and practice them, train them. So if community support is there, you will never feel the disaster. You can face the problems very easily, tackle the problem very easily, because community support is more important. If they cooperate you, you will get less time to rescue the people. So, like Western Command facing floods, Pakistan area. And every time in rainy season, there are floods. So, you are facing the Western Command, mostly flood disaster management, and you are experts in that. I know, because earlier I was Ministry of Home Affairs as a director there, and they have given me the Western Command as a Deputy Financial Advisor of the Border Security Force. 6 years stint was there. So I know the Indian Army is doing better job in every situation. Whenever district administration fails, Army bulao, and Army to finally solve कर ही देती है. That's all. Thank you very much.
Thank you very much. It's a nice discussion, and being as a civilian, we understood many things, because from news only we came to know that armed forces are doing, Air Force, Navy, paramilitary forces are doing. But inside, we got lot of insight, and it's a good knowledge for sharing for us also, and knowing many things from you. So, because time to time, we used to, being as a state government officer, we used to have interact with the territorial army mostly, because for plantation purpose or something. But discussing the hardcore issues of army for civilians is really interesting, and we are looking forward that we will have more discussions on this, because being as a scientist, we are dealing with here in Uttarakhand, we are having an institute known as Uttarakhand Council for Science and Technology, and we are having a beautiful science museum in Jhajra. So I request all of you to come along with your family, although cadet regularly from IMA and RMC, they are visiting there and with their regular basis, but I request you to come with your family also. And now we are constructing another facilities district-wise. We are planning to have science parks over there, so that students in far-flung area, they can understand science well. So with these words, I like to thank each and every one of you, Air Commodore K.S. Lamba Saab, given insight of IAF, what all you are doing during disaster. Brigadier Saab given a detailed presentation in morning time, and in between also Brigadier Saab given the insight of army and cleared many doubts of ours. Colonel Hemant, son of a soil, given many examples of what all rescue case studies from Uttarakhand and other part. Colonel Madhukar nicely coordinated this session over here. Dr. Tyagi is with us in UCOST, and he was a former scientist in DRDO and then financial advisor in BSF for some time. And we are fortunate enough that we are having a DIG SP Chamoli Saab with us, old mount trainer. So I request you, sir, to please join us here for handing over the mementos to our speakers here. So I request you to come over here, sir, please. Yes. Can we have please? I request Air Commodore K.S. Lamba Saab to please come over the dais. Brigadier Upen Paul Singh, sir. Big round of applause. Colonel Hemant, please. Colonel Madhukar, please. Dr. Tyagi. Commandant G.P. Uniyal from Rapid Action Force. Thank you very much. Thank you so much. Pleasure. And I request all of you for a group photograph, please. Thank you.
आदिकाल से उत्तराखंड की धरती विश्व को सही मार्ग दिखाती आ रही। कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग को खोजने के लिए उत्तराखंड सरकार 6th वर्ल्ड कांग्रेस ऑफ डिजास्टर मैनेजमेंट का आयोजन कर रही है। आखिर आपदा से जूझना और उससे जीतना हमसे बेहतर कौन जानता है। नमस्कार, धन्यवाद। आदिकाल से उत्तराखंड की धरती विश्व को सही मार्ग दिखाती आ रही। कभी ऋषि मुनियों के ज्ञान से, कभी योग के प्रकाश से और कभी धर्म के विचार से। आज पूरा विश्व जलवायु परिवर्तन और ग्लोबल वार्मिंग से होने वाली आपदाओं से जूझ रहा है। तो उनसे लड़ने के सही मार्ग